All right, I think we're live. Mic check 1 2 1 2. Mic check 1 2 1 2. If anyone in the chat can hear me, just push one. All right, just got a confirmation. Thank you for the confirmation. Welcome back to the Black Brain Trust. This is episode 424, Black Health Talk. Please hit the like button as you come in. Share the video if possible. Also hit that notification bell so you get all the updates from the Black Brain Trust, including those posted on the community tab. Docket and description beneath the video for you to follow along with. If you want to engage in the discussion, there'll be a link in the chat for you to click on. When you click on the link, make sure you raise your hand so that one of us can acknowledge you and bring you to the panel. I should have probably have contacted Dr. Phoenix, but the reason why this is starting very late is because the channel has been down for the last 3 or 4 hours. We've had some API issues with the Zoom client to YouTube, and that has delayed the whole entire start of this this program. And so we're starting late. I don't even know if it's going to last. It's been very complicated trying to get this to work. So that being said, link is in the chat. Let me give a shout out to the people who just showed up. Sherrod Martin, PCU, Excalibur, salute. Willie Little John, what's going on? SLP Chronicles, how are you? Jeff, what's going on? We'll wait for a couple more people to come in. We got some likes coming in as well, so. All right, let me get started with the live. Oh man, this is the wrong link. All right, this is the wrong ones. All right, let me get started with the first item on the docket. I don't know how long we're going to be on here for. This one's from businessinsider.com. Buzzy primary care startup One Medical just filed to go public. Meet the 8 companies changing how doctors get paid and building the future of medicine. Should be interesting. All right, expand this out. In the past few years, a crop of companies has been gaining steam with new approaches to primary care. Rather than getting paid for each visit or procedure that a patient needs, startups are looking to change the way primary care is practiced. In many cases, working to get paid a large fixed sum each month to take care of all patients' health needs. In many cases, that means seeing fewer patients a year, hundreds rather than thousands, offering additional services or making the process of getting an appointment more convenient. In other cases, are taking note. And others are taking note. For instance, health systems, including Utah-based Intermountain Healthcare and Pennsylvania-based Gissinger, are taking similar approaches with some of their primary care doctors. The federal government is planning to pay for care for some Medicare patients in a similar way too. Investors have taken an interest in the model, pouring hundreds of millions in funding into some of the companies, and the space stands to bring in even more cash. One Medical on Friday filed to go public, where Iora Health is looking to raise at least $100 million by the end of the year. The rise of some of these models, in particular venture-backed Iora, family-owned Chen Med, and private equity-backed Oak Street Health, comes at a time when the market for Medicare Advantage plans has grown increasingly competitive. As of last year, more than 20 million Americans were enrolled in private Medicare Advantage plans. People can typically choose to enroll in traditional Medicare or Medicare Advantage plans when they turn 65. Either way, their health needs are largely funded by the U.S. government. Read on to see how these startups are shaking up traditional way we do medicine. So we start with the first one, One Medical. What One Medical does, when the San Francisco-based primary care startup One Medical opened for business in 2007, its goal was to upend the way people got medical care by making it easy and convenient to see a doctor. The company charges a $200 annual fee and bills your insurance. Over the next decade, it became the primary care startup to beat. After a big infusion of capital, it's expecting to double the number of medical clinics it operates over the next 2 years. It has 77 locations in 9 cities and is increasingly focused on signing up companies to provide care for their workers. While One Medical does accept some private Medicare plans, it doesn't take Medicaid, according to its website. One Medical's doctors and health professionals are limited to seeing 16 patients a day. Funding raised, the company raised $220 million in funding in a 2018 round led by the Carlyle Group, according to a spokeswoman for One Medical. In total, she said the company's raised $408 million. One Medical on Friday filed to go public, according to its filing with the U.S. Securities and Exchange Commission, SEC. One Medical plans to raise $100 million, which is a placeholder amount and can change. The filing shows that One Medical's losses have increased even as the company is signing up more customers. One Medical had 397,000 member as of September 30th. Iora. What Iora does, founded in 2010, Boston-based Iora works with sponsors, mainly employers or private health plans for the elderly, known as Medicare Advantage, that cover a monthly fee for primary care. Iora also built out care teams of nurses and other health professionals that can help the doctors within the practice. Iora says the approach is working. In one group of Medicare patients, Iora says it reduced hospital admissions by 50% and emergency room visits by 20% over 18 months. Doctors care for a group of about 500 to 700 patients, depending on where they practice and the health of those patients. Funding raised The company has raised more than $250 million from investors like GE Ventures, Cosa Ventures, Team Mazik Holdings, and Humana. Interesting, Humana. In October, Business Insider reported that Iora is raising at least $100 million more as it looks to expand in 2020. So Dr. Phoenix has talked about this many times before in Black Health Talk, that Iora also, it says, I'm just going to quote this again, Iora also build out care teams of nurses and other health professionals that can help the doctors within the practice. Dr. Phoenix is a nurse, and many other, well, I shouldn't say many other, but Super Triz is also a nurse, and so is Michael Coleman, and a few others are nurses on here, Ichisa as well. And you see the proliferation of nurses in the practice of startups. They're becoming more prevalent in these startups now. You're starting to see more of that. So keep that in mind, because Dr. Phoenix has talked about this in the past. The number of clinics, Iora has more than 30 clinics. It plans to open another 16 over the rest of 2019 in states such as North Carolina, Georgia, and Colorado. Village MD. Chicago-based Village MD was founded in 2013 with the idea of giving primary care doctors more resources to help them manage the care of their patients. Instead of cutting down the number of patients doctors see per year, the hope is to add in monitoring services, transportation, and other ways to keep patients healthier. Village MDs doctors manage the health of about 2,000 patients a year, including those on commercial insurance, Medicaid, and Medicare plans. Rather than get paid based on the number of visits doctors have with patients, Village MD works with insurers so that it gets paid based on how well it cares for patients. So basically, it's merit based and not just quantitative per visit based, which is how most hospitals work, or most practices work. We don't get paid unless we can drive better quality, CEO Tim Barry told Business Insider. Instead of building up new practices from scratch, Village MD brings in existing primary care practices with existing patients, helping them transition to a different payment model with the help of software and operational support. Village MD has a mix of doctors who are employed by Village MD and who partner with the company. After raising an additional $100 million in September, the Village MD is building out its primary care services in the home, as well as build on its partnerships with Walgreens. By the end of the year, the company expects to start operating 5 of its primary care clinics within Walgreens in Houston, Texas. So they're leveraging existing infrastructure. Walgreens is a brick and mortar that already has infrastructure in place. All they have to do is cut a piece of the of Walmart the floor space to themselves, and they kind of nestle themselves in there. This is actually like an Airbnb model for healthcare. I don't know if anybody's paying attention to this. They're leveraging that existing infrastructure and slotting themselves right in there. Very interesting strategy. In September, the company said it raised an additional $100 million in a round led by the investment firm Kinevic. In total, the company raised $216 million. There's a lot of money moving around these healthcare startups. They're going to be the game changers because their strategy is a lot more radical than what you've seen in the past in legacy hospitals. Legacy hospitals, they're kind of stuck on old systems. They still have a lot of overstaffing and resources and stuff of that nature. So they don't really turn a profit all that well. They just charge a whole lot of money, and it doesn't really work out well for them. So it says Village MD currently works with more than 2,500 doctors who work in about 215 practices across 8 states. This is a game changer. All right, this one is Chen Med. Miami-based Chen Med was founded 32 years ago by Dr. James Chen. The family-owned organization manages the health of seniors enrolled in Medicare Advantage plans. Under the arrangements, plans pay Chen Med a set amount to keep their members healthy. Chen Med offers services like on-site pharmacies, transportation to and from appointments, exercise options, and social networking with other seniors. To do that, doctors in Chen Med's practices typically manage about 300 to 400 patients a year. Chen Med's chief growth officer, Dr. Dayal, told Business Insider a much smaller group than the thousands of patients doctors in traditional primary care usually see over the course of a year. The company is family owned and operates more than 60 clinics across 8 states. Interesting. So family-run practices tend to seem to be doing very well. I usually only see corporate-based practices. This is my first time seeing like a family-based one. Hey, what's going on, Dr. Phoenix?
Hey, what's going on, brother? I am sorry. I did not. I was meaning to say something to you about it yesterday because I saw it popped up on my YouTube for the prostate cancer chat, but and I do have the notifications on, but for some reason didn't tell me that this was happening. So.
Oh man, we had a bit of an issue. You're not really aware, but yeah, there was a bit of an issue between Zoom and YouTube, and so I couldn't go live. I couldn't do anything today after the initial hangout. So been offline all 5 hours. I've been working with support trying to get this resolved. Only got it resolved a few minutes ago. So
Yeah, Advocate Health. This is in Chicago. Well, I think this is in Oak Park in Chicago.
mm-hmm.
That's what I think. That's what the article say because this looks pretty familiar. I think I know what this is at. So.
Mm-hmm. Let me just read this. Chicago-based Oak Street Health provides primary care to seniors, in particular those who are eligible for both Medicare and Medicaid. It works with Medicare Advantage health plans and those on traditional Medicare to get paid to manage the health of members by driving them to and from appointments and offering them social events and more time with their doctors. Like Iora and Chen Med, Oak Street's doctors see fewer patients than traditional primary care, caring for around 500 patients. Funding: Oak Street is backed by the private equity giant General Atlantic. Number of clinics: it has 45 in the Chicago area: Philadelphia, Cleveland, Detroit, Indiana, Rhode Island, and North Carolina. Do you know anything about this, Dr. Phoenix?
No, I don't. I'm not too familiar with this, but I do know this is kind of the movement you're seeing within the health system because for years now, what typically happened is that you've seen larger. I mean, technically, Advocate is a massive health system. If anyone's not familiar with Advocate Health,
Mm-hmm.
actually, they're pretty much all throughout Illinois, parts of the U.S. in general. But they have a major foothold. They're pretty much the premier um, health organization within the state of Illinois. In fact, they just brought up one of the major health organizations here in my state in Wisconsin. They just brought them out
Wow.
about 2-3 years ago, and an ex girlfriend of mine, she actually she's been involved for years now with the transfer and the rollover and stuff like that with them kind of transferring their assets, their departments, because Advocate was not a user of Epic, but this particular health system they brought out in Wisconsin is one of the primary. They use Epic, and so Advocate is actually converting all of their EMR systems to Epic right now.
Wow.
So, I can tell you that one from just personal experience. I know, and because one of the the organization they brought out, I used to work for. So actually, I did my internship with them and worked for them at one point. So.
Yeah, that's interesting, man, because it looks like a plaza based, sort of setup here.
Well, that's what you're seeing because you're starting to see a lot of these kind of sort of they almost are like they're not really urgent cares, but they're not really ERs, but they're just kind of these sort of these I wouldn't call them standalone clinics neither. They're kind of something in between where you're going there, you're getting your primary care services, but you don't have to, you don't have to go into a big, unnecessarily a big, clinical setting, something more personal, right in the community, which is what I talked about before, which is
Mhm.
where this is the movement you're seeing in healthcare, where healthcare is shifting away from hospital-based medicine to community-based medicine. And
Yep.
what you were speaking about earlier with the reimbursement, that's what's happening now is that hospitals are being dinged and physicians and primary and and healthcare providers are being dinged for not producing outcomes. And specifically, this is probably mostly falling on physicians because they've been the principal dispensaries of primary care throughout
Mhm.
the years. But however, because most of what they didn't have any real tangible outcome, and they were just making lots of money. It became more about Medicare, Medicaid, and various health insurances were not. They started to now reimburse you based more on whether or not your reimbursement was tied on patient outcomes as opposed to just doing whatever.
Yeah, yeah.
So
There's a
that's
lot
kind of
of
what
money.
happened. Is going from a what you call a fee for profit model to a value based system.
Mhm. We talking about that, and it seems that there's a lot of money being invested into the startup sector of this. This is like the new startup, right?
I can tell you right now, man. I mean, where I'm at, man, you got outpatient. I mean, you got all kinds of folks with outpatient startup dialysis centers where I'm at. I mean, you got a whole chain of dialysis centers in the hood. Black folks can't get a goddamn kidney, but you can certainly go for the next 10 years of your life and get dialysis treatment.
Yeah, for seniors healthcare is or for seniors Medicare for seniors Medicare or not Medicare medical, that's what it is. For seniors medical is actually headquartered here as well in Boston or just outside of Boston. I've been there many times before I actually go drive by when I go to work in the morning. They're the largest network of dialysis care in the country. They're like,
Yeah, I mean, this is what's happening now. I mean, and although dialysis is very specialized and for a very different reason, but I do classify them within that arena simply because of the fact that you're seeing a lot of these services being shifted directly into the community. So you're building these clinics within plazas, within these strip malls, whatever you want to call them. And so people are able to, they're easily accessible. You don't have to go to this big massive institution on the other side of town to get seen by a provider.
yeah,
You can travel within a mile or two of your home and you're at a community clinic or something like that where you can get seen. And so again, that being able to bring healthcare to where people at, meet people where they are at is really what's happening and really what's the goal going forward in the future. And part is because they're just looking to reduce just the per capita cost of healthcare. I
yeah,
mean, we're talking like healthcare, depending on numbers you look at, anywhere between 20 cents of every dollar to 25 cents of every dollar, depending on the numbers you're looking at.
mhm,
So I mean, it's for sure this country spends the most in healthcare, but yet the outcomes are no different in many respects to many developing countries,
mhm.
especially when it comes to chronic disease. You know, so I mean, again, I think this is I'm actually glad to see that, but I think part of the problem has to be again because this is about prostate cancer now, and I will go into this later. I don't want to take up your time to read the article, but I personally think a lot of what has to happen is that there has to truly be models of healthcare that truly addressing early early detection, like in prostate cancer and cancers in general. Early detection, certainly with cardiovascular disease and preventing heart attacks, early detection. Why? Because in the case of someone who's experienced a myocardial infarction, that part of the heart where that takes place dies. It does not regenerate. So
Wow.
that's just lost function.
Mm-hmm.
And so now the other parts of the heart have to compensate. So that's where you get issues with enlarged heart, cardio megalopathy, stuff like that. So where you start to get some of these other issues that are compounded by the fact that if we weren't able to prevent a heart attack in the first place, now you're having physiological changes that have taken place that are going to cause more issues and more complications down the road.
Mm-hmm.
So, you know, just to kind of put that a little bit into perspective, why these newer models of healthcare. But you did point out something interesting though. This is why you're seeing this big movement from these big pharmacy chains like Walgreens, CVS, stuff like that to get into the space, because this is where it's at. You
Yeah.
know, you don't really find CVS's like that in the hood quote. You'll probably find a Walgreens, but you probably wouldn't find the CVS, which
Well,
they're
out here, keep in mind out here, we're on the East Coast. CVS's headquarters is in Rhode Island, and
yeah, yeah.
so CVS is dominant here. They're like the juggernaut here. Walgreens is actually the low.
Yeah, you can find them here. Where I'm at. If you're in the Midwest, you can find Walgreens all over the place. So.
Yeah, because it's headquartered out there in Illinois. So they're very dominant out there in the Midwest and out the West and in the South. But over here in the East Coast, there's a CVS on every corner.
Yeah, no, yeah, you're absolutely correct. So I just think that this is where the models of healthcare are moving, and I don't want to take up too much of your time, brother, because
It's good. It's good dialogue, because a lot of people don't realize that we have been talking about this for a while now. That this is a new space, and that's why you should be enrolling into RN. If you're not going to get into any other place in STEM, this is where it's going to be. We just read the excerpt up above where it said that they're hiring these nurses in these startups, these health startups now. So to assist with the doctors, and even though they're seeing fewer patients, with the nurses actually going to be instrumental in designing a whole lot of the applications and whatnot that go into these platforms. So,
well, again, outside of physicians, nurses are the single largest group of healthcare uh, uh, practitioners in this country. There's about twice as many nurses as there are physicians.
mm-hmm.
So you have about 3 million or so nurses versus about 1.4, maybe 1.5 million or so physicians in this country. So you roughly have a 2-to-1 ratio, if you will. But again, just given sort of the health issues in this country, and especially when you're dealing with chronic diseases like diabetes, hypertension, cardiovascular disease, stuff like that, you're seeing, and you're seeing this proliferation of these other groups of healthcare providers like nurse practitioners, which is why, like I said, you go to the minute clinics, and what what Walgreens are doing with their I forgot what they call theirs.
Minute clinics?
Was that?
They call it a minute clinic?
Yeah, the CVS does the minute clinic, but I can't remember what Walgreens calls theirs. It totally escapes me.
Yeah.
But if you go to those are specifically ran by nurse practitioners. In fact, they are some of the most prolific hirers of nurse practitioners. And for a new nurse practitioner coming out of it, the salaries aren't real bad at all, to be real honest with you.
Mm-hmm.
And again, they're understanding that to being out in the community and meeting people where they're at is key. Here, it's much easier for people who can walk down the street to a damn CVS to get seen by a primary care provider that can screen you out for potential heart disease, and maybe you might be on the verge of having a heart attack, or screen you out for being on the verge of having a stroke. It's much easier to get seen by that if you can walk a couple blocks down the street from your house to get seen by, maybe a nurse practitioner, for example, at a minute clinic, or even at, I forgot what Walgreens calls theirs. You can do it there as well. And again, the interesting thing about the minute clinic is that if you're a nurse practitioner there, you're the one running the show. You build out everything. Basically, it's really your business. They pretty much, you get entrepreneurial mentorship, because basically they walk you through the process of building out the whole practice from top to bottom.
And the thing is, and I want to welcome Super Trish to the panel as well. The thing is, they're running these mini clinics like it's an Apple store. You know, everything about it, it looks just like an Apple store. It just in the healthcare format, in a clinical format.
Well, yeah. Well, I'll go ahead. If Triz wanted to add something to that, I'll go ahead.
Well, I mean that's what happens when you have an actual retail entity with an actual with a particular business model that focuses on customer service and revenue enter this space. And what that will consequently do is raise the bar. So now that, you know, conventional hospitals will have to enhance their experience for the customer base, as well as incentivize the staff. So I think it's an actual win-win. You know, that competition is actually very helpful, because otherwise, you know, a conventional hospital would never fully embrace the digitization to the extent that, you know, say for instance, a Walgreens or a CVS would. In particular, you know, that actual smaller, I guess a smaller actual framework than a conventional framework by a larger hospital. They're able to actually do more, I believe, and I think there's a certain degree of autonomy, even though they do try to have basically an overall similarity between each individual place. There is a certain degree of autonomy because, like Dr. Phoenix said, the actual provider to the LIP, most cases is going to be a nurse practitioner in that particular setting, has a certain degree of autonomy. So they're able to kind of mold the practice that kind of suits their actual provider style.
Yeah, I think the big hospitals, you know, the legacy hospitals, they're like an aircraft carrier, man. It doesn't do a 3-point turn that easily, man. It takes time for them to turn around technologically, as well as just from an operational standpoint. They just don't move that way. They're too slow to move like that.
Well, they were never designed to.
Yeah.
Your hospitals make their most money by keeping you there.
Oh, yeah.
The longer you there, the better it is for them. So someone just standing in the ICU. You think about, for example, a few weeks ago we had that talk about maternal fetal health, and understanding that a neonate being born weeks early. So instead of being born at 39 weeks, you're born at, let's say, 30 weeks. So you might have a neonate might have to stay in a NICU for, we're talking 4, 5, 6 months. That's more than $1 million for one baby.
Yeah, so I do see a
So you think about just these long-term stays within hospitals in general, or just being admitted in general, in many respects are pretty big moneymakers for these systems. So again, they have no true incentive to really turn value, really turn those massive ships around.
Interesting. Let me get to this next startup here, Forward. What Forward does, for $150 a month, Forward acts as your primary care provider, along with providing some extra perks and technology with the intent to keep you healthier. The company doesn't take insurance. Forward's a type of doctor's office that's similar to direct primary care, a small but fast-growing movement of pediatricians, family medicine physicians, and internists. That's how you pronounce it. This group doesn't accept insurance and instead charges a monthly membership fee that covers most of what the average patient needs in their prescription drugs at much lower prices. In Ford's case, membership includes unlimited visits, blood testing, vaccines, genetic testing. The company declined to disclose how many patients each of its doctors sees on average. Funding raised. Ford declined to comment on the amount it's raised. As of 2019, it had raised $100 million, according to BuzzFeed News. Number of clinics, Ford has 7 clinics, most recently opening one in Washington, D.C., as well as spots in Southern California, San Francisco, and New York. So funding seems to be really, really key here. Every company has raised at least $100 million. There's a lot of money moving around in this sort of healthcare startup space, regardless of what their practice is, whether it's some kind of membership base or urgent care base. There's a lot of money moving around in this sector, and I'm surprised that most people have not paid attention to the market in this way. That if there's money moving around like that, then there means going to be a lot of opportunity at the ground level too.
Well, I've talked about direct pay services before, direct pay care models before. I mean, this is what you're seeing among a lot of primary care providers. So your internists, which are your internal medicine docs, your family practice docs, your pediatricians, and you're seeing this. Why? Because these are more profitable models. Your primary care docs really get chewed up in these big health systems. That's why you see so many docs just like, they're running for the hills, in primary care, because they really do get chewed up. If you're in one of these big systems, like let's say like Advocate, what we were talking about earlier, you already have to meet a quota. You have to see a certain number of patients, usually between 40 and 50 patients a day. You're seeing a lot, and you imagine you're doing this and you're not making a whole lot of money because you're generating a lot of money for those health systems. But again, the health insurance companies are taking a big chunk of that, and so are the hospitals. Probably, actually, be honest with you, the health insurers and the pharmacy companies are taking the biggest chunk of that.
Yeah.
And to say it, and so again, what a lot of primary care docs are doing, and I've even met a couple of nurse practitioners that have similar models set up, where you're shifting to that. One, you can make a lot more money. Two, you can actually have a normal life. You can actually have a relatively 9 to 5, because typically what these direct pay care models do, generally it's like a membership service. So it's kind of like if you had was it like a 24-hour fitness membership where you pay every month. That's pretty much how it functions. You pay directly. That's why they don't take insurance. So you pay directly into it, which gives you 24-hour access to whoever that provider is. So you can call them or text them whatever question you have, pretty much any time of the day. But again, most in primary care, typically folks don't have any major urgent issues that pop up. So so for the most part, it's very profitable, but it's also much less stressful, because again, most of your primary care docs, man, they have patient panels like 1,500, 2,000. I've seen some with even 3,000, and that's a lot of damn patients to be seeing over a year.
Yeah. Super Truth, do you have anything you want to add to this? I think Super Truth might be busy. All right.
Kurt, sorry, I had some technical difficulties. Yeah, I completely concur with this assessment. You'll find that, like you said, there's you have a large patient load. They have specific parameters that they have to see the patient. I believe last time I checked, I think it was like, what is it, 18 minutes per patient. This is a couple years ago, so I think it's even less than that now.
Yeah, it's like 50
but that's specific benchmarks, like in a primary care setting, you have to see a patient like every 18 minutes, and when you're going that fast, a lot of times you're missing things. So you have to kind of balance the actual speed, accuracy, and customer service aspect. So that's very, very, very nerve-wracking, especially a lot of times these people that go to medical school, they end up being very fastidious, very particular, very detail-oriented. And so when you're working under those particular stressors, it's hard to be detail-focused because you're just rushing through certain things. And you're not really, I think the problem is that when you're talking about like in particular medical school and just the medical profession, a lot of times there's not the information is not as forthcoming for whatever reason. Maybe it's just that there's a disconnect between physicians and the general populace. Maybe the general populace just doesn't inquire, or people entering that field don't really inquire about what it actually means to be a physician, and as well as the sacrifices that you have to make. So, but the information is not being conveyed nonetheless, and people get into these particular fields and they realize it's not all it's cracked up to be. And I'll just leave it at that.
No, I agree with Sutras. I mean, oftentimes what happens is that now it's like you have to see 4 patients an hour if you're a primary care provider. So you're averaging about 15 minutes per patient. So I mean that there's no way you could possibly hit every single thing that's going on with a patient, or really kind of catch some of those early warning signs of, various diseases or whatever in a 15-minute period. You just can't. He's right. You absolutely are going to miss stuff. And this is oftentimes what happens.
All right, this one is Parsley Health. What Parsley does, founded by Dr. Robin Berzin in 2016, Parsley Health is focused on functional medicine, which takes a more comprehensive approach to treating the underlying cause of a disease, looking at it more holistically than case by case. $450 monthly fee, you get primary care visits, nutrition plans, supplement regimens, and more in-depth genetics and microbiome. Is that how you pronounce it, Dr. Phoenix?
Yeah, microbiome, yes.
Yeah, microbiome testing. Parsley does not take insurance. In 2019, Parsley started moving into pediatrics, offering similar services at a price of $129 a month, with the hope of providing better care for children and teens with chronic conditions. Now the startup plans to take its business national through a virtual service that will also cost $150 a month. A spokeswoman for Parsley said that its doctors max out at seeing a few hundred patients per year. Funding raised. The company in October said it had raised a $26 million Series B round, bringing its total funding to $36 million. Number of clinics, 3, based in New York, Los Angeles, and San Francisco. The telemedicine service to start is available in New York and California, with plans to get into all 50 states over the next 6 months, Parsley said it in October. Galileo Health. Founded by One Medical founder, Tom Lee, Galileo Health is a new company that charges an annual fee to provide some care online or through an app. The cost is $59 for basic services like prescription refills and treatment for simple ailments. Paying $139 a year also gets you doctor consultations for more complex conditions, lab tests, and referrals to specialists. According to Galileo's website, right now it's available in the New York City area. The startup plans to have an in-person healthcare component, particularly focused on sicker patients covered by Medicare and Medicaid. The company is hiring primary care doctors who have experience caring for patients in those programs, according to job listings. Galileo funding raised. Galileo is backed by venture firm Oak, HCFT, which led the company's Series A round. Number of clinics, it's all virtual for now. So, say what you want to about medicine, but things are changing to a point where that traditional, all these sitcoms you see, all these little reality TV shows you see with Married to Medicine, all that shit. This is a different ballgame, man. You can get into medicine now for a fraction of the cost of what it was maybe 20 years ago.
I mean, yeah, I think certainly moving in an investor space, for brothers, if you don't have a clinical background, as you can see, I mean, a lot of this is really being pushed by investors, and because there's just such a huge need to kind of fundamentally change the current delivery model within the healthcare system. Again, the current healthcare system, at least in the way that healthcare is delivered, is just massively flawed and hugely expensive to not just to the individuals themselves, but to the taxpayers, to the country itself. Again, the U.S. has some of the high pays the most for healthcare, but yet has some of the worst outcomes in the world.
Yeah. Since IORA says this is the one from IORA. IORA says the approach is working. In one group of Medicare patients, IORA says it reduced hospital admissions by 50% and emergency room visits by 20% over 18 months. Would you say that's significant, Triz? Or
Yeah, I think he had to. I think he had to take off.
oh, okay.
Yeah, but no, uh, yeah, it is significant. I mean, again, I've discussed previously just how crowded some of these emergency rooms can be, especially if you're in the inner city and you're dealing with inner city populations. It can just get really crowded, and these ERs, especially this time of year, can be really busy.
Yeah.
And most of the time, the folks that are there aren't really there for emergent acute conditions. They're really there because they should be having access to a primary care provider, but they don't. Not to be joking about this, but I mean, the what did it say? What did they say? It reduced hospital admissions by 50%.
50% ER visits by 20%.
I mean, that's massive. I mean, you think about it, the Centers for Medicare and Medicaid pays 50% of all healthcare costs in this country. So again, this is costing them a lot. This is costing the taxpayers and the government a lot of damn money. So by doing that one particular startup alone has been able for the folks in their for the patients in there that they provide services to, they've been able to reduce those uh, hospitalizations by 50%. That's pretty massive, man. Especially when you're dealing with folks with chronic conditions like diabetes, for example, where 9 times out of 10, those folks are going to end up in the ICU because you got an infection that it got treated but just doesn't go away, or if it does go away, it comes back. You just got recurrent infections, that eventually can lead to, gangrene, amputations, lots of complications associated with just diabetes alone that ultimately will end you up in an inpatient environment as a patient.
Yeah, crazy. We used to have this major issue up in Boston as well with ER rooms at Boston Medical Center flooded with all types of people, man. The poorest of poorest people, man, just in there, and you were waiting all night for to see a doctor, man. It didn't matter what your problem was, unless you were a gunshot victim. You weren't getting seen, man. You were going to be there for a long time. I know when I went to go schedule an appointment with my endocrinologist, that thing was like 6 months out.
Wow. And that's about right. That's on average. So I mean that's not really surprising.
Yeah.
I mean, I think part of what happens here is that I don't get why, because just kind of considering some of the conversations that has been happening in this space, especially here on this particular platform over the last week or so, I don't know why for the life of me, for Black folks, we don't understand. This is what's happening. Everyone is figuring out, there's these major push within, whether it's tech that's influencing the health system, but now you have huge amounts of venture capital that's pushing this innovation within healthcare systems and healthcare enterprises, where they're figuring out ways to move it either to direct care pay models like what you were just reading, or they're moving it, or you got these major health organizations that are figuring out how we can move these primary care docs and providers into the community, so that folks ain't got to travel 3, 4, 5, 10 miles in some cases to get to a damn hospital. I talked about it where I'm at, there's only like 2 hospitals that service the entire population of the city. If either one of those hospitals go, there's at least a 30-minute goddamn drive to a level 1. And 9 times out of 10, if you're in a acute condition like you're experiencing a heart attack, for example, you're probably going to be dead before you get there.
Yeah.
And so this is one of these areas where, if we're able to at least rethink how primary care is delivered, for example, by bringing it into the community, making it more accessible to everyone, whether it's the Walgreens or the Rite Aids or the CVS's or these big health systems, you know, being able to have these providers in the community means that these folks can catch these issues before they become really serious issues.
Yeah. Yeah, we got Sauchi on the panel as well. What's going on, Sauchi?
What's going on, brother?
Hey, good evening, guys. I'm glad we're definitely having this conversation. With the direct service, I definitely agree. I mean, actually, a businessman, I never forget, this was years ago, he was talking about this, and he was saying that, we'll see that there's going to be a lot of consolidation going on. Lo and behold, that's what's been going on, for the past couple of years within, the health system. In regards to, functional medicine, I mean, anyone who's interested in that, I mean, you can go to ifm.org and get all the information there. I do see that things are, especially because of Obamacare, which they've been trying to push since Reagan, actually. I look at it as a hybrid kind of service because, private doctors have always been around, but I mean, realistically, they were reserved for rich people or people who could actually pay cash, So I see that's why you are seeing a lot of venture capitalists get into it because it does make sense. Our healthcare system is, as a whole, is atrocious. I mean, we're talking recent numbers, roughly 74% of the population is fat or they're obese. Statewide, the vast majority, 20% or more, are fat or obese. In the states that aren't, they're in the high teens. I mean, it's just unsustainable.
Mm-hmm. Mm-hmm. Let me get to this next one on the docket. This is from Business Insider again. $19 billion startups to watch that are revolutionizing healthcare in 2020. In 2019, a handful of health startups went public with valuations above $1 billion, placing them in unicorn territory. Let me expand this so I can't see anything. Next year is shaping up to be an even more prolific year, with companies like One Medical planning to go public in the first quarter. I think this is a rehash of what we saw before. Let me go to the ones that we didn't cover. First one on the list is Rani Therapeutics. The biotech startup Rani Therapeutics is taking on a problem that has eluded companies for decades, finding a way to turn injectable drugs into pills for people living with chronic conditions. The approach has the potential to upend billion-dollar markets for drugs such as insulin and treatments like Humira for autoimmune.
You were right the first time it's Humira. They give it for stuff like RA, like rheumatoid arthritis.
Okay, thanks. The San Jose company, California company, raised $53 million in February from Alphabet's venture investment arm, GV. To date, Rani has raised $142 million. Clover Health, $1.2 billion. Clover Health sells Medicare Advantage health insurance plans. When people in the US turn 65, they can choose to be part of traditional Medicare or Medicare Advantage, which is operated through private insurers like Clover and often provides additional healthcare benefits. The hope for San Francisco-based Clover and other technology-based health insurers is to use data to improve patients' health. Clover lost $26.5 million in the first 9 months of 2019, according to the state insurance filings reviewed by Business Insider. The 2019 loss was deeper than the company's net loss of $18.7 million over the same time period in 2018. Clover had 42,000 87 Medicare Advantage members at the end of the third quarter, up from 31,902 at the end of the third quarter of 2018. It's been a big year for Clover. In March, the company said it was laying off 25% of its workforce, or about 140 employees, as part of a restructuring that came on the heels of Clover raising $500 million in January, bringing the total funds the company has raised to $925 million. There's a lot of money moving around. Rakuten Medical, $1.2 billion. Headquartered in San Diego, Rakuten Medical develops precision-targeted cancer therapies designed to treat solid tumors. The biotech is led by the Japanese billionaire Hiroshi Makatani, who is also founder and CEO of the large Japanese e-commerce firm Rakuten. Makatani said he was inspired to fund the cancer research after his father was diagnosed with pancreatic cancer in 2012. Rakuten Medical has raised about $471 million, according to PitchBook. Both Mikitani and Rakuten have invested in Rakuten Medical. So this is the same company that actually sponsors the Golden State Warriors. If you look at their uniform, you'll see that on it. Lyell, $1.2 billion. San Francisco biotech company is focused on treating cancer with cell therapies. Lyell's goal is to develop cell-based immunotherapies for cancer, which with a focus on CAR Ts and solid tumors. Earlier this year, the company raised $179 million in Series B venture funding from Foresight Capital Management, Arch Venture Partners, and Altitude Life Science Ventures. The company has raised a total of $358 million, according to PitchBook. A lot of money moving around, man. Butterfly Network, $1.3 billion. Butterfly Network, a company that developed an iPhone-based ultrasound device, wants to make the technology more accessible to doctors and healthcare workers so they can make more precise diagnosis on the move. The device, called Butterfly IQ, plugs into the iPhone and isn't much bigger than the iPhone itself. It's been approved by the Food and Drug Administration for use in imaging the abdomen, bladder, and heart. In September 2018, Butterfly raised $250 million from investors such as Fidelity, Fosun Pharma, and the Bill and Melinda Gates Foundation. In total, the company raised $370 million.
You know, here's the ironic thing. You know, what's kind of a little annoying is that they keep making all this stuff initially for iPhone, where a lot of these apps have been done over in places like India for a few years now. They've done stuff. They've used imaging. They have apps that do imaging, use phone cameras for retinal imaging in India and some other countries in the world, where they've done these various types of technologies now, way before the US decides to jump into this game. But they make it for iPhone, but in most of the world they use Android. I'm trying to understand, why is that? I get that most people here in this country use iPhones, obviously, and so I can see why that's the case. But I do kind of have a problem because
Well, because iPhone, the iOS platform is easy to develop on. Okay. So it's with Android, you have too many variations. You have Samsung, LG, and all these different variations. And what happens here is there's fragmentation in development. So what works on, let's say, an LG phone may not work on a Samsung, and vice versa, and whatnot, and Motorola, and so on and so forth. And so the fragmentation causes a lot of development issues. That used to be the case maybe 2 or 3 years ago, but now that shouldn't be the case. But I do agree with you about the the iPhone, the iPhone support here on in terms of medical. I think what happens also is that most of your best app developers, man, focus really a heck of a whole lot on the iPhone, because it's just one platform that they have to support. So
yeah, I agree. I mean, you're right. I do find it ironic, just in general. I mean, very interesting piece of technology. At least I'm well aware of similar technology being used in other countries for a few years now, especially when it comes to like retinal imaging. Because I mean, basically, a lot of stuff that involves image, a lot, excuse me, a lot of specialties in medicine that involves imaging. You're seeing these mobile applications being developed so that people can have access. They can just use their mobile devices to that to do imaging or whatever. So whether it's retinal and stuff like that. So kind of interesting. I definitely think this is going to be the wave of the future where people are going to be able to do a lot of this stuff from just their phone, from just their mobile devices, and you maybe have a specialist on order or something that can analyze or even use most likely AI. I think something like this would definitely be prime for AI.
Oh yeah, 5G, AI, machine learning. We talked about this many times. I really think we're missing out on a big opportunity in terms of getting into the cannabis research, and other chronic diseases in that space. I mean, who smokes more? Smokes more than a little bit than the brothers do, man. I would say the sisters are involved in that too. I would say 9 out of 10 sisters I've dated the last 2 years, man, in professional settings have been connoisseurs of the green leaf. I mean,
Yes, that's a fact.
it's very interesting, man. How did you get this job if you smoke that much, man? They don't really care too much. So.
But here's the thing, man. When you're looking at these technologies, and I just want to throw that out there. I want to throw this out here real quick. Certainly for about what the past 2 months almost now. I mean, on Saturdays, you and I have been doing these streams where we've kind of really been dissecting a lot of these various things going on within the healthcare industry, and sort of just really the dynamic. Oh my God, I can't pronounce words tonight. Good God, the pace at which innovation is happening within the healthcare system, and understanding that there is going to be a major and this is actually yeah, this is Johnny Blaze's area, brother. Yes. And so just understanding where these are going to be prime opportunities for brothers, for black folks to get involved, where we can you can certainly think about just really the training. And again, this goes back to the discussion from about a couple weeks ago, where where the stuff came up about nursing and Deloitte and sort of their their research. But again, they're not telling you just to the baseline education that's needed now is not what you're gonna is gonna not what you is not what you're gonna need in the future. You're gonna need something well above that to get into these fields. And these fields are gonna as you see all this technology proliferate, you're gonna see these various professions having to respond in kind. Why? Because again, as I've said before, you're seeing where healthcare professionals now need to know more than just need to have more than just your clinical knowledge at your tips. You're gonna have to be to an extent. You're gonna have to be a master of some form of tech. You're gonna have to have some knowledge of computer science, something up to that extent. You don't need to be an expert and nothing like that, but you certainly need to be somewhat proficient.
Mm-hmm.
I had a quick comment. I noticed this was back in 2001. Japan had a toilet that can analyze your urine and your fecal matter, and the information could be sent to your doctor. This is 2001. And I would talk to people about it here, of course, and people are just oblivious, including people in the medical field. So now with wearables, as they're calling them, from what I see, I could be wrong. I mean, Dr. Phoenix is in the field. I see medicine pretty much going that route. Like you can use your phone, get your blood tested right there, or it's reading your pulse. It's maybe reading your eyes or anything else, and it can go straight to either your direct doctor or CVS, Walgreens, or even EMT if it's an emergency case, and everybody's already prepared before you even get there. I mean, that's what I see, but I could be wrong.
Yeah, Japan runs a different sort of ball game.
Yeah, they do. You know, there's none of this recalcitrant anti-science, anti-whatever behavior in Japan that you see here in the States. You know, they're just really not this. And you can say that's true of most other places in the world. They're far more open to experimenting with new technologies within the healthcare sector as opposed to here in the States. Again, because everything here in the States, if it makes a lot of money, it's not broken.
Yep.
I mean, that's
Okay.
just long and short of it.
All right, the next one is HeartFlow, $1.6 billion. HeartFlow is trying to make the process of finding blockages in the heart a lot less invasive. Using imaging from a CT scan, HeartFlow builds a 3D model that pinpoints the blockages associated with coronary artery disease, a heart condition that affects millions of Americans and is the leading cause of death in the United States. HeartFlow is based in Redwood City, California, and reached unicorn status in 2018 after raising $240 million. In total, the company has raised $532 million. That's something, man. ZocDoc, 1.8 million.
I mean, you keep talking this stuff, and again, we're seeing how you got all these, you got all these really young-looking folks,
Yep.
but they're billionaires. They're millionaires and billionaires.
Mm-hmm.
They're getting into the startup business.
ZocDoc helps patients book doctor's appointments and check in for them. Everything from primary care to dental to optometry appointments. Users can search based on procedures, conditions, and even a particular doctor they might want to book an appointment with. In 2019, the company changed the way it pays its doctors in some states, moving from a subscription model to one that charges a per booking fee. Some doctors haven't been happy about the switch. ZocDoc, which is based in New York, recently raised $130 million in Series D round in August 2015, bringing its total raise to $223 million. The company last reported valuation is from 2015, according to PitchBook. So they're basically like a
They're like a virtual receptionist, to be honest.
yeah, they're basically like I don't know if any of you guys are familiar with the corporate tool, which is Concur. Concur is used to book these sort of appointments for business executives, so they can have hotels and meeting rooms and stuff like that. It does it all in limousine rides and airport trips and shit like that. It's all set up. So this is kind of like Concur or Concur. Sorry, Concur. Devoted Health, $1.8 billion. Devoted Health wants to reinvent how we care for aging Americans. The company started selling Medicare Advantage plans in parts of Florida for 2019. The company's plans might look a bit different from traditional insurance in that devoted plans to do more than they pay for visits to doctors and hospitals. It's also hiring nurses and other employees directed at keeping seniors healthier and out of the hospital. Devoted was founded in 2017 by brothers Ed and Todd Park. Before Devoted, Todd Park co-founded the health IT company Athena Health, which is not too far away from me, it's about 5 minutes away from me, and served as the chief technology officer of the U.S. during the Obama administration. Ed Park, who served as Devoted's CEO, was formerly the chief technology officer and later chief operating officer at Athena Health. I used to go there for the health IT meetups at Athena, so I'm very familiar with that place at the headquarters.
Mm-hmm.
In October 2018, the Waltham, Massachusetts-based company raised $300 million in a Series B round led by Anderson Horowitz, bringing its total funded to $369 million. Waltham is a hotspot for life sciences. So
yeah, I was reading about that because I was kind of looking into some careers as medical science liaisons.
Yep.
and I've seen quite a few coming up out of there.
Yeah, there's a whole entire zip code or multiple zip codes within the Waltham Reservoir area. All your life science companies are going in. They're building them out right now. So I work in that area, so I'm familiar with that area. But a lot of your companies that we were talking about before, Dr. Phoenix, that were in Cambridge and Boston, that were supposed to hire these minorities as a part of their tax breaks and whatnot, they're running away to Waltham. So
really, so they can get out of Cambridge.
Yep. So that Waltham is a hot spot for this stuff. It's one on every corner. It's all over the place. It's in your face. You can't miss it around that reservoir. So I'm quite familiar with it. Bright Health, $2.2 billion. Bright Health provides health plans for people under the Affordable Care Act and to seniors in Medicare Advantage. It was founded in 2016 and has raised more than $1 billion after closing $635 million round in December. A representative for the company declined to provide its updated valuation, though according to PitchBook, the valuation is $2.2 billion. Minneapolis-based Bright Health posted a net loss of $9.3 million for the first 3 quarters of 2019, a deeper net loss than the $4.2 million loss for the company had over the same period in 2018. The company made $164.3 million in revenue and recorded $127.9 million in medical claims.
You know, here's the interesting thing about Minnesota.
Mm-hmm.
Minnesota has I don't know if anyone's familiar with the history of Minnesota, at least in regards to its health organizations, but you have the Mayo Clinic. But they have probably one of the most vibrant, most profitable health systems of any state in the country. I mean, you can be a primary care provider there and go to Minnesota and make they pay their primary care providers quite nicely up there. If you're nurses, if you don't have a BSN, don't bother trying to apply for a job in Minnesota. I'll tell you that one off back. Yeah, Minnesota is one of those major health tech hubs. I'll put it to you that way. You know, it's kind of hard to believe because you're up in the upper Midwest, a state above me, and, you know, it's really cold up there. But again, it is a major health and tech hub up there.
All right, next one is Tempest, $3.1 billion. Chicago-based Tempest got its start in 2015, and in the past 4 years, it has rocketed into unicorn territory. The startup, which was founded by Groupon founder Eric Lefkowski, hopes to help doctors use data to find better cancer treatments for patients, using both clinical data and information about which medications patients have taken and how they responded to them. And it sequences in its lab based on tumors and hereditary genetics of cancer patients. Tempest raised $200 million in Series F venture funding from Novo Holdings, Revolution Group, and New Enterprise Associates in May. So far, the company has raised a total of $520 million. This is a guy who used to make coupons for people on the internet. I mean, think about that, man. We're getting beat out by guys who clip coupons, man.
But it's funny, if the articles you read so far, have you noticed a lot of these startups are coming out of Chicago?
Yep.
And I've talked about Chicago before, but yet we got this, you know, there was this article you read, you went over in the summer where you got folks running to the South, and I was like, I'm not for that. People don't, and this is why.
Mm-hmm.
When you read articles like this is why I'm not for that.
Mm-hmm.
Because again, you know, yes, the population of Chicago is getting smaller, but it is becoming more affluent, and you're seeing why.
But that's the reason. In places like that, you actually have to compete, and you actually have to be, you know, amongst the best. So you have to be well educated and or connected. So if they're not playing that game, they're not good. They're gonna lose, and they know it. That's probably why they're going all the way to freaking Atlanta for, you know, I don't know, work for Verizon.
Yeah.
Yeah,
Yeah.
but Atlanta is also a place too. You need to be pretty well connected there too, because they have a very strong health system, very strong tech um, um, industry there. So I mean, it's also a place where I at least in my experience being there, you do have to be fairly well connected there as well.
And plus, Atlanta doesn't have the same sort of futurist drive that, let's say, Raleigh Durham is going to have in the next 12 months. It's going to explode down there big time. It's already big now, but I mean, it's going to really explode because you're going to start seeing more startups come out of those spaces. Duke University, UNC, NC State, all those universities down there, all those sort of, Red Hat is headquartered in Raleigh as well.
Yeah.
There's a whole lot of shit that's going to come out of Raleigh that not going to move from Atlanta.
Yeah, I absolutely agree with that. So I think if brothers are looking to get into healthcare, there's a few places, a few states I recommend you going to. North Carolina is one of them for sure. I definitely recommend North Carolina. I recommend Arizona, but that's a discussion for another day. So
yeah, I think we covered mostly startups already. So let me cover this one right here. Roviat Sciences is a company known for developing drugs that other pharmaceutical companies have abandoned. The company was founded by CEO Vivek Ramaswamy, who's 34. Though its subsidiary companies, it identifies experimental drugs that other companies have stopped developing for one reason or another that still has potential to get approved and go on the market. So far, it has launched 17 subsidiary vent companies, including a number that have gone public. Those include the neurodegenerative disease drug developer Axovent Sciences, the women's health company Myovent Sciences, and the urology company Eurovant Sciences. In December, the company entered a deal with Sumitomo Donipopin Pharma. Before that, the company had raised $200 million from investors a little more than a year after raising $1.1 billion in monster round led by SoftBank's Vision Fund. The $200 million round valued the company at $7 billion.
God damn.
34 years old.
Jesus.
I mean, and we have all this damn small talk going on.
Oh yeah, yeah. It's unbelievable, man.
And I've noticed that the Indian guy was the only melanated one on the list, which doesn't surprise me. And all these series, of getting money, I try to tell black folks, man, like you gotta stop playing. You gotta stop complaining about quote unquote the white man. No one is paying attention to you because you're technically not even in the game. You're not in STEM. You're not in high finance. You're not well connected, or you don't have money for you to even technically invest in these series because it's for accredited investors. So you're losing on all ends.
Yeah.
Well, it's like, and it goes even deeper than that. If you look at the lot of folks that are leading up these R&D divisions and whatever, a lot of folks that sit on the boards and the committees for these companies, you look at them, many of them have doctorates. At the very least, they have a master's.
Yeah.
Most probably have doctorates. Yep. But if you look at them, if you read their bios, they all probably knew each other.
Yeah.
Oh, yeah.
That's why I preach the importance of, yes, brothers need to take your asses to these damn 4-year schools. This is why.
Yep.
Yeah.
The folks you meet might be your partners tomorrow.
Yeah, that's why college is so important in the technology sector, because that's where everybody meets each other. If you look at Facebook, Zuckerberg met his co-workers or people in the startup of Facebook from university. That's where they met at.
I mean, I can't think of the last time I truly have ever formally applied for a job. Mm-hmm. In undergrad, man, that's how I got my internship. That's how I got into research, everything. it all came from that experience. And
Yeah.
that's why I push this. And again, brothers talking about it ain't feasible, or this kind of some elitist talk. No, the problem is that I don't understand why brothers think that you're gonna get something for free. You're gonna have to make some sacrifice. You're gonna have to sacrifice something. Yes, we've heard the stories of Steve Harvey being poor, the stories of Tyler Perry being poor, writing scripts for plays out of your car while you're homeless.
Mhm.
We hear these stories all the time. Now, I'm not saying that's the life you have to live, but I am saying you're gonna have to give up something to get what you want.
And those are also the exceptions of the rule anyway. So, why even go through all that when you can just focus on your strengths and just, buckle down. But, again, I guess the swag juice is just, just gets the girls going, and that's more important, apparently.
Well, let me hit this last one. All right, this one is our Intarsia Therapeutics.
Is that the Kramer report?
Yeah. Intarsia Therapeutics, a Gates Foundation-backed biotech, is developing implantable devices intended to treat conditions like type 2 diabetes and prevent HIV. And September 2018, the FDA put the Boston-based company's plans for its diabetes implant on hold, citing manufacturing concerns. The company resubmitted the implant for approval in September. In March, the company raised $73 million of convertible debt from funding from undisclosed investors. To date, the company raised $2 billion. I know a chick that actually works there. I used to date in that space. She works in regulatory, but this one really catches my attention, Roviant, because what they're doing is they're taking failed projects and they're trying to
They're monetizing.
yeah, they're monetizing the failed projects, but they're actually they're moving it on, right? It's kind of like
I mean, no, you're absolutely correct, especially considering that they're looking at drugs that that pharmaceutical companies gave up on, trying to bring them to market because of FDA regulation or whatever the case may be. If you understand the timeline for how drugs are developed, it usually takes about 10 to 15 years to bring a drug to market.
Yep.
And then considering that in that 10 to 15 year period for one drug, the average company is going to invest somewhere between 200 million to almost $1 billion.
Yeah.
So you have a wide range of money that will be spent in the development of just one drug. And this is over a 10 or 15 year period. So imagine just the kind, the number of drugs they're probably working with, because they're, for all the ones that we know about, we hear about, trust me, there are about 3 times as many that you don't hear about that never made to market, that were in clinical trials that completely failed. And so companies just gave up on them, and they never wrote about it. They never published the articles, they never published the results, they never wrote anything about it. So that's something to keep in mind. So they're still able to make all of this damn money, raise all this damn capital, even though there's no real guarantee that they're going to have a successful product.
Yeah, and this last one right here, this other one caught my attention as well, the Butterfly Network, because Johnny Blaze works in this area, or has been in this area academically, in terms of imaging, medical imaging. What's your take on this, Jay Blaze?
Oh, he's on.
Hey, yep. What's going on, fellas?
What's up?
Consulting work. There you go.
Okay. All right. So what's the question there, Mike? I'm sorry.
Yeah, what's your take on? I don't know how much you've caught of what we've read, but this Butterfly Network raised $1.3 million for a imaging device on the iPhone, based on the iPhone, ultrasound.
So, and I'm gonna try to keep this like really, really brief and kind of like dumbed down. So a lot of the imaging tech, it's gonna really depend on like resolution. And like if you're trying to do like real diagnosis, a lot of things like MRIs and CTs, for instance, they can be read on a basic computer screen. Now, when you get into like your standard x-rays, you're going to get into your different high level monitors. Mammography requires a really, really high level monitor. But if they're just looking at like really basic stuff, you can look at it on like a phone or like a tablet of some sort. Really, it's just going to come down to how well, what's the resolution on the physical device itself.
Mm-hmm.
Okay.
Well, I would say this. I do know that their Samsung is planning to bring 4K phones to the market. I mean, right now they got phones that are like 2K.
Yeah.
But I mean,
So,
it's
like,
pretty high resolution. But
yeah. So like right now, like I said, mammography requires like 4K or higher to look at. But there is a big X-ray conference. It's called RSNA. It happens every December in Chicago. And that's where they do like all of the new medical imaging equipment. Typically, it's about 10,000 participants every year that comes to see this thing.
Mm-hmm. Funny how you keep going back to Chicago.
Yeah. At the McCormick Hotel, as a matter of fact.
Yeah, right on the lake. Yeah, right across. It's right on the lake. I know where it's at. Yeah, but I think it's ironic how a lot of these things keep cycling back to Chicago, which is why I say what I say.
Yep.
No, I just think this is, yeah. Go ahead, brother, please.
Yeah, Butterfly Network, a company that developed an iPhone-based ultrasound device, wants to make the technology more accessible to doctors and healthcare workers so they can make more precise diagnosis on the move, also while listening to iTunes. So, I read these articles to, so that people can get a better understanding of what we're really talking about here in terms of startups and stuff, the things of that nature. We read one of the companies went through Series F around the funding. Like that's really far in the process. You don't get to Series F unless you pass Series A, B, and C. So that gives you an idea of if you have an idea and it's sound and it's soundproof, then there's a high probability that it will get some investment funding. However, I think Black people are missing out on this as well because we're not investing into our own startups for that matter. If we had startups, we should be the biggest VCs involved in this type of stuff.
Yeah, and it's ironic considering a city like Chicago, third of the population. That's even considering the decrease in the Black population. Still, a third of the population there is Black.
Yeah.
That's yeah. Yeah. Please do continue, brother.
Yeah, so with Complex has talked about this. He's been very vocal about this legalization of cannabis, engineering cannabis as well. Shout out to engineering cannabis. We think that there's a lot of opportunity in marijuana research. We know that some of these mega companies probably have already done it, but I still think there's a lot of opportunity on the ground. We've talked about the entry into the legalization of marijuana. Getting involved in it is the startup cost is actually pretty reasonable if it's done correctly, if it's well thought out, and instead of just smoking it for recreational purposes. I think that there could be a lot, to be discussed in terms of startup, going from a startup perspective in the medicinal aspect. All right, let me just read this real quick from businessinsider.com. Companies like Walmart, CVS, and Amazon are beefing up their healthcare strategies. Here are their plans to upend the $3.6 trillion industry.
And what was that collective buying power of Black folks again?
Was it $1 trillion?
Not even half.
Let me expand so. As healthcare costs keep rising, leaving Americans on the hook for higher bills, retailers see an opportunity to win patients over with more convenient places to get care and or lower prices. It's led to the lines around what constitutes a healthcare company being redrawn, with retail pharmacies like CVS Health acquiring insurers and tech companies like Amazon getting into the pharmacy business, and major grocer Kroger investing more in keeping its shoppers healthy with the help of food. It's also happening at a time when those same retailers are also competing to get customers to still come through their doors as more and more shopping moves online. One way to do that is to have customers come to the centers for checkups, lab testing, or other health services. Here's how retailers like CVS Health, Walgreens, Walmart, and Kroger are bulking up their healthcare strategies. Walmart is building new health clinics, and that's just the beginning. Walmart Health, interesting.
Wow.
Walmart is preparing to launch a massive push into healthcare as the giant U.S. retailer vies for a bigger slice of the $3.5 trillion U.S. healthcare industry. The retail giant plans to offer services such as primary care, counseling, home care, and dentistry. Sean Slovinsky, Walmart's president of health and wellness, told Business Insider. Walmart is starting by opening prototype health centers in northern Georgia that could quickly make Walmart into the largest provider of basic healthcare in the region. The goal, he said, is to do for healthcare what Walmart supercenters stores did for retail, offer a breadth of services conveniently and at a much cheaper price point than rivals. For instance, a primary care visit costs $40, while a dental visit costs $25. Slovinsky said the clinics are a big piece of the company's health strategy. We see these as being a crown jewel of what we want to accomplish in the physical world, in the home and in the virtual world as well, Slovinsky said. This isn't the first time Walmart's built out its retail clinics. Walmart, which has more than 5,000 retail locations in the US, has been eyeing healthcare for more than a decade and previously announced ambitious health plans. While the company had planned in the past to have as many as 2,000 clinics open, it currently has about 20 clinics over 3 states. So Slovinsky acknowledged Walmart's past missteps and said the current push was a top priority for the company's senior leadership, including U.S. CEO Greg Foran and CEO Doug McMillon. Like a lot of retailers, everyone's eyes were bigger than their stomach when they bellied up to the buffet, he said. We finally got to the point this past year with the right strategy, the right team, and right timing. CVS Health bought health insurer Aetna as part of its plan to make itself the place Americans go when they get sick. Dr. Phoenix was just talking about MinuteClinics. In 2018, CVS acquired the health insurer Aetna, combining nearly 10,000 pharmacies, a drug benefits business, and one of the biggest U.S. health insurers. The result is an entirely new healthcare company that can wield a tremendous amount of power over how healthcare gets paid for and provided to people. The $70 billion acquisition accelerated a reckoning for CVS over the purpose of its drugstores. As consumers increasingly shop online, they are coming into CVS stores less for things like milk, bread, and toilet paper. Instead, CVS wants consumers to think of the stores as a place for healthcare, where they can get their dry skin examined or check in about their diabetes. It's now turning about 1,500 of its stores into health hubs, which can provide a broad array of health services through the health hubs. The plan is to help people manage more chronic diseases like diabetes, keeping them healthier and out of the hospital. Kroger is betting it can keep you healthy by tracking your groceries and prescriptions. In the past few years, Kroger has the largest supermarket chain in the U.S. has resurrected itself to bring its 2,200 pharmacies, 215 health clinics, and nutrition services all under the purview of Kroger Health President Colleen Lindholz.
What's her name?
You mean the president?
Yeah.
Colleen Lindholz.
Okay.
Kroger's goal is to decrease the number of prescriptions dispensed in favor of promoting healthier lifestyle and food choices to grocery and pharmacy customers. To do that, it's invested in technology that can track prescription and grocery buying information. That way, it could nudge consumers toward healthier choices as well as give pharmacists a better look into patients' eating habits. Kroger is also looking to get paid by insurers. Health insurers already pay for dietitian services, such as coaching, but Kroger wants them to cover a food benefit in the same way they cover a procedure or a pill. The hope is to have insurers pay for a box of healthy food to be shipped to a member's house. Interesting.
Yeah, I'm liking that model.
That's an interesting perspective. Amazon's purchase of online pharmacy PillPack put the rest of the healthcare industry on notice. Amazon in 2018 sent shockwaves through the healthcare industry when it said it was acquiring the online pharmacy PillPack. PillPack mails prescriptions to people who take multiple medications, packaging them together based on dose. The company has pharmacies around the country that send out medications by mail. In response to Amazon's PillPack deal, others have gone on the offensive. In June, healthcare giant CVS Health filed a lawsuit against a former employee hired by PillPack, in which CVS alleged that PillPack is competing with its services and coming after its clients.
That's smart. That is very, very smart, because a lot of those their minute clinics tend to service an older population. And so your older populations tend to be the ones that take multiple meds. And so instead of having them where they have to use their pill organizer where they have to, put a certain number, put the pills in they take every single day and organize their pills, their medications that way. If you have the pharmacy doing it for them and they just ship it to them, I mean, it's a 2-for-1 deal. You can't beat that. I mean, it's a pretty brilliant move on my part. I just had on their part. I just had.
I hear you rubbing your hands together, Dr. Payne. So you must have been like off the clock.
It's a brilliant move. I mean, if you look at any senior that takes meds, most of your seniors take at least 10, 15 meds. And they have, everyone that I've known, I remember I had an ex-girlfriend. I used to go to her grandparents, and I used to help them organize their meds, because they would have to organize their meds for like a month out. And so they'd be here, and it takes them like a few hours to kind of put all their meds in their dispensers for a month. And so if you have a company that's taking away all that time from doing that, I mean, that's pretty powerful.
In addition to PillPack, Amazon is building out its services for its employees. In September, Amazon revealed its new health clinic program, Amazon Care. Through the program, which is still in the pilot stage, Amazon employees in the Seattle area can get virtual visits with doctors and in-home care that includes delivery of prescription medicines. The company has also acquired a digital health startup called Health Navigator, which will join Amazon Care, CNBC reported in October. I actually got offered a role to work at Amazon Care. I wasn't going to relocate though, but yeah, I wasn't going to relocate, man.
They trying to bring you up to Seattle?
Nah, man. If they're trying to get out, maybe it's time for me to reconsider as well. So I wouldn't want to move there. But
that's funny.
Yeah, Walgreens is leaning on partnership and building out its health services in some locations. Walgreens has also been striking up partnership with grocery stores, health plans, beauty subscription boxes, and tech giants Microsoft and Alphabet's life sciences arm, Verily. With the hope of finding a new way to make use of the drugstore's footprint. For instance, in its partnership with Microsoft, the two plan to test out health offerings, including 12 pilot digital health corners in stores. And in a bid to get more customers coming through its doors, Walgreens has been experimenting with putting different health services in its locations. Those include hearing screenings, eye exams, and lab tests, in addition to the 9,300 pharmacies the company operates in the U.S. but the company is shying away from owning and operating those health services. Walgreens, the second biggest operator of retail clinics in the US, is shrinking its footprint. The company said in October that it's closing more than 150 clinics and plans to work with health system partners to run about 200 others. The partnership strategy has drawn skepticism from investors. However, because they fall short on the big transactions pursued by the company's rivals and are slow to add profits to the company's bottom line. In November, news outlets reported that Walgreens is reportedly considering going private. In a report that private equity firm KKR has formally approached the pharmacy giant, had the stock soaring.
Oh man, KKR, yeah, it's a done deal.
Yeah, Walgreens is
Yeah, they're playing catch up. They're playing catch up.
yeah, they're nowhere near where CVS is right now. So they're having more friends that have your same interests is better than trying to do everything by yourself, especially if you don't have the capability. And so that's where that comes in. Best Buy is betting on healthcare moving into the home. Oh my God, these guys.
What they gonna do? They gonna have the Geese Squad come out?
Oh man. The squad.
Oh man, bend over. No, you gotta go.
Yeah. Consumer electronics retailer Best Buy raised eyebrows in 2018 when it bought emergency device company Great Call for $800 million. Since then, it's gone on to acquire Critical Signal Technologies, a health services company, for $225 million. At Best Buy's Investors Day in September, the company outlined how it plans to use healthcare to help grow its business, including monitoring the health of seniors in the home. Within the next 5 years, Best Buy is aiming to get 5 million seniors into its programs, said Ashish Saxena, president of Best Buy Health. Best Buy's healthcare strategy could unlock $11 million to $46 billion in total revenue over time, Morgan Stanley analyst said in a note on Monday. Interesting. You get your laptop fixed and you get an eye exam or something like that, man. Interesting.
Yeah, it's very easy to do an eye exam, just without some of the more traditional ways of where you're doing the wisp test or getting your eyes dilated or whatever. You can just use camera systems, and as long as you got a dark space to do it, they're very specialized camera systems. The technology was first invented, I want to say, over in Europe. I want to say maybe even in Italy. And it's starting to you're starting to see other countries pick up on it, but they use camera systems. They actually use LEDs to take pictures of your retinas. So.
Yes, interesting, because Best Buy has a lot of retail space. I don't know if anybody's been in one recently. I mean, there's a lot of empty space inside the store. It's very underutilized for what it's trying to do.
Well, I think this just comes down to the fact that a lot of what has happened with Best Buy is that they have not been able to stave off the giants of I even say even before Amazon really started taking their lunch, I think Walmart was taking their lunch.
Yeah, I'm surprised that Best Buy has not gone into the grocery section of the market, because Walmart does everything that Best Buy does. It still sells groceries and so on and so forth. I know there were rumors a few years ago about them bringing in Tesla cars to sell them. I'm not sure if they were going to partner with Tesla or they were going to partner with Toyota and Nissan to sell electric vehicles in there. But there was rumors about them selling electric vehicles in their stores. So because they had so much floor space that was underutilized. We had kind of kicked around an idea before that they could potentially turn their stores into movie theaters, at the premium level, for exclusive movies and whatnot. It's unfortunate that companies are run by companies like this are run by Momo. So they have, like somebody in the chat that said, Health Squad, you know, guys popping up in fucking Volkswagen Beetles try to take your blood pressure.
Hey, Mike, it's Johnny Blaze here.
Yes, sir.
Hey, I was, you know, as someone that used to work at Best Buy, and you're right, they have a lot of premium room. I'm surprised, like, they don't take some of their space and maybe do, like, you know, video game tournaments. They got all the high tech stuff there.
Yeah. Yeah, they probably could do something like that. But again, they're run by Momo, so it's not hard to fathom that, you know, they can't seem to get a lot of things right. I know Micro Center back in the day used to do land tournaments. Land tournaments are local, those of you listening, it's a local area network tournament. So basically everybody brings their computers and there's tables set up. And
yeah, that's the old school way before you had the
yeah. They used to do something called frag for tots. So fragging is a term used in first person shooters for killing your opponent. You frag them. And they used to do, you know, these sort of fundraising tournaments and stuff like that for kids with special needs and whatnot. They don't do that stuff anymore because of the proliferation of consoles. But that used to be, like Dr. Phoenix was saying, that used to be the way that people used to play games together. But yeah, Best Buy is missing out big time. You're right about that. You know, using the floor space for like gaming tournaments and stuff like that.
No, I mean that is technically a good idea. I mean, they do have the name recognition within the industry. I mean, all it just matters now is just will be able to, you know, get the partnerships. But I don't know who runs Best Buy, but clearly they're not too bright. So,
oh man,
yeah, the numbers just came out on gaming. We already know it's exploding, but we're talking over $1 billion industry, and VR is getting insane. And I was actually talking to a gentleman who has a close friend who actually works at Nintendo, and they're saying Nintendo they're ready for VR. They're saying that they see the industry really taking off in 5 years, but Nintendo's ready within the next 2 years.
Well, like, remember Nintendo used to have Game Boy VR 25 years ago.
Yeah.
They did. The Virtual Boy.
Yeah.
Hey, you know, man, my university, we have a video game sports team. We call it the esports team.
Yep.
I mean, this thing is huge. I mean, they're giving scholarships to these kids to play video games now.
Yeah. Those systems, man, are powerful enough to actually deliver telehealth.
Yeah, I mean, they got the nice alien. I mean, they got the premium computers down in the esports lab. This thing is like totally dedicated. It's closed off. They got a cyber lock on the door. It's like, it's high tech.
Yeah.
I'm sure they got locked up. You got those $5,000 Alienware towers.
Yeah. I mean, we've kicked around ideas before in the startup space about leveraging, you know, Xboxes and PS4s and things like that for telehealth and stuff like that. Because although they're proprietary, it wouldn't be difficult to actually write an application to work on the platform because it's only one platform that it needs to work on. And it could easily, because the way people are glued to the system, you might as well utilize that system's performance in hardware. So
it's a very smart idea. I mean, you already have a built-in base, so I mean, it wouldn't be much of an issue to draw people to the platform because you already got hundreds of millions of people on the platform to begin with. And so, you know, just being able to leverage the users of that platform and to bring them into other areas like, you know, telehealth. You know, we already know a lot of gamers are not exactly the healthiest, but, you know.
Oh, man. all the little sugary drinks they drink, man, the Red Bulls and the Monsters and stuff like that.
Well, you can order like Pizza Hut and stuff like that. You can order stuff from restaurants from like Xbox Live.
You're a gamer, right?
I wouldn't say I'm a gamer, but I do play when I do have time. But I mean, I wouldn't call myself a gamer.
Okay.
So, not like the old days, man, when I used to have Alienwares and Falcon Northwest computers. Not like those days. Now, back in those days, You know, I used to be pretty hardcore gamer, man, but playing the Unreal tournaments and Quake and all that stuff. So
Yep. Yep. All right, next one is from fastcompany.com. This devastating opioid overdose map shows America is fighting 4 distinct epidemics. Expand this out. Turns out that a single opioid crisis doesn't actually exist. This year, over 70,000 Americans have died in 4 distinct opioid epidemics, each bringing death through different drugs and regions. Researchers at Iowa State University studied death certificates nationwide and found these 4 separate drug outbreaks. The West and Midwest heroin epidemic, the overdose deaths cluster along interstates known to be smuggling routes for Mexican cartels.
Yeah, that's, you know what, not to cut you off, Mike. That's why I talked about before where I'm at in Wisconsin, because Wisconsin are along some of those routes. So people go there, they'll come up from the south and go in from like Missouri into Chicago, and then they'll go even further north into like Kenosha, Wisconsin. And so when I did a public health clinical rotation, we actually got briefings from the sheriffs and the ATF and the DA on this, because they have whole task force. They have a task force that they put together specifically to deal with the smuggling that happens, because they all traveling through through the Interstate 90 and 94.
This epidemic is quite active in urban areas, and from El Paso to Denver, and in Texas through St. Louis into Chicago. The rural southern prescription epidemic. This is a continuation of the nationwide pharmaceutical overdose crisis that peaked in 2013, but continues in rural counties. The opioids mostly come from pharmacies, often prescribed to work-disabled former miners or manufacturing workers for their pain. Now that pharmaceuticals are more difficult to access, traffickers are creating counterfeit pills with prescription drugs such as oxycodone and hydrocodone mixed with
hydrocodone.
Yeah, hydrocodone, sorry. Yeah. Mixed with easy to overdose on synthetic opioids such as fentanyl. Wow. Like a fucking nuclear bomb.
Fentanyl is what they give the end-stage cancer patients for pain. That's the only thing strong enough to stop end-stage pain from end-stage cancers.
Mm-hmm. The urban fentanyl epidemics. Street drugs such as heroin and cocaine are mixed with synthetic opioids and often made to look like prescription pills. This is ravaging northeastern cities as well as parts of Utah and New Mexico. The unemployment opioid epidemic. Some unlucky counties are undergoing a syndemic, which means multiple epidemics at once where people consume whatever drugs, prescriptions, heroin, synthetics, they can't get their hands on. This is happening in regions where the opioid epidemic first blossomed in the 1990s, and which have since undergone heavy job losses from mining and manufacturing in states, including Kentucky, Ohio, and West Virginia. Interesting. I mean, we talked about unemployment, or even the minimum wage, going up $1 could actually reduce suicides at a substantial rate. Well, here's further evidence that what unemployment will do to a person. Co-author David Peters said in a statement that blanket policies aimed at stopping the opioid crisis will not work. Better regulation of prescription opioids by states is going to have no impact on heroin deaths or synthetic deaths. Peters says, heroin epidemics are best approached by traditional law enforcement and targeted treatment, while the prescription epidemic is best addressed through poverty reduction and economic development. Interesting.
Yeah, if you go back up to that map for a second, Mike.
Yeah, let's do that.
Yeah. If you see that little section in Northeast where you see where it's red, where it's kind of, you see a lot of red.
Yep.
that area, if you remember a few weeks back, you had an article where the states that were paying for folks to relocate, and
Yep.
you know, and I talked about folks that area, that northeast, and one of them was Vermont, and I talked about that area, Vermont. I think Maine was one of them too as well, and I talked about the area being a heavy opioid. That's a there's an area heavy with in the opioid epidemic, and how just being a provider, if you, let's just say you were a nurse practitioner, because I'm pretty sure in Vermont and Maine you have full practice as a nurse practitioner, for example, and I just using them as an example, and how you can come there, they will pay you to come there, help pay off your student loans, all this stuff, but you can make a guapa damn money just treating folks who are addicted. You know, if you were like a family nurse practitioner, and or a psychiatric nurse practitioner, for example, where you can prescribe Suboxone, which is what they use, which is part of what they use in treating folks who are addicted to opioids. Think about that. You would make a ton of damn money, and plus you ain't gotta pay. Plus they're going to be paying off your loans. But you see, this is the heavy areas. It's all in this central northeast sector. Why? Because these were your heavily industrialized parts of the country.
Yep.
Yep. Yeah, and out here we have something called methadone mile, which is a long strip where you see a lot of zombies out there. People just walking around like feed me brains, man, like World War Z, because of the opioid crisis, man. Really horrific to watch. People just shoot up in the middle of the street, or just they're hunched over like literally like zombies. Never seen anything like that before in my life, other than the movie, man. So
Yeah, that northeast area is really is. I mean, it is pretty much the epicenter of the opioid crisis. And also too, I would say the area too in between that Ohio Pennsylvania area. That's the other hot spot.
who the hell is this right here? Yeah, damn. My ADD kicked in there. So man, but yeah, man. Yeah, synthetic RX mixes or synthetic prescription mixes. They're right about that, man. I saw some people, man, just take some old lady's bag of pills, man. From, I guess she left it in her passenger seat of a car, man. Bust the window with it and took it. They're popping it. You don't even know what those pills are prescribed for. Like just popping those things in their mouths, man. Like it's nothing.
Well, if you remember about a few years ago, um, there were all these videos coming out over the summer. I want to say maybe about 3 years ago, of all these, white folks just ODing in their cars. They're ODing in front of children. I mean, just out in public, just ODing on heroin and other opioids. And again, this is, I mean, and it was right in these areas. A lot of these videos were coming out of.
Yeah, for Wisconsin, it has a lot of this brown and beige, which is high heroin, emerging heroin.
Yeah, because if you look at it, I mean, Kenosha is only about 45 minutes from Chicago, about 45 minutes from Chicago. So if you if you look along there, I mean, you can just go up through Texas. So they can come in through Texas, and they can just kind of go along there and go straight into Missouri, up into Illinois and Chicago, and just continue north into Wisconsin. So I mean, it's a it's pretty much a straight shot for these folks, along these who are driving for these dealers, driving along these various routes. But
Yeah, unclassified, huh? Up in Oregon, unclassified. That's a large population that's unclassified. I wonder how they get the heat maps like this.
what's that?
So I wonder how they get these heat maps like this, because it's hard to find, a lot of information off the top, because a lot of states don't always report a lot of this stuff.
Well, it's not necessarily the They are reporting it. It's just that they're probably looking at folks who are coming into the ERs, who are folks who are coming into these health systems and they're ODing, or eventually they get involved. They come into the health system in some form or fashion. And so typically it's kind of like with STI uh, 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 surveillance, where it kind of goes up the chain. You come into a health system, you get seen for a particular reason. Then that usually gets reported out, not necessarily required in some instances, but in some they are. And then it kind of goes up the chain, goes from the city to the state, and then goes from the state to someplace like the CDC. I would imagine they're getting this from the CDC, and the CDC got theirs from that, because I mean this would be something that epidemiologist does.
Oh, is that a good career? Because I heard in the chat yesterday it's not.
Look,
do you know what you're talking about, Dr. Phoenix?
I I'm just gonna say this much. Go. Some of your original epidemiologists were nurses. That's why many nurses do this, built into a lot of the into the education. But in general, a lot of epidemiologists, they work for the CDC. Many of them work for drug companies, because they're pretty much the healthcare equivalent of a statistician, if you will, where they're tracking incidence, prevalence, and stuff like that. And so you can see how they got this stuff group where you can see these clusters. So I mean, it's a great career. I mean, you typically, to function at the levels to be in the CDC, you typically need a PhD. You need a doctorate. I actually know a young lady just finished up her PhD as an epidemiology. So I think she's off working for the CDC or the NIH now as we speak. So very good careers, high income careers. I mean, you can do a lot with it. So I'll the person that said that to me, they clearly haven't heard any of the streams we've done. So I'll leave it at that. Dana-Farber Institute. Interesting. Anybody there?
Yeah, I'm here. I hear you.
And
Mike might be going through something. I don't know. I don't hear him.
Yeah, I can't hear you, Mike, if you're speaking, brother.
I had to step away for a second.
Okay.
All right, let me expand this out, and we'll get started on this last item on the docket. For WebMD, prostate cancer in African American men. Since the 1990s, prostate cancer death rates have dropped for all men, most of them all for African Americans. That's progress for sure, but it's not the full picture. Black men have a greater risk of getting prostate cancer, and a more aggressive type than white men, says Brandon A. Mahal, MD, a radiation oncologist with the Dana-Farber Cancer Institute. Very familiar with
in your area.
It takes a grim toll. Black men are more than twice as likely to die from the disease. What's behind the numbers like these? And what needs to change? Many things come into play, including access to care, genetics, environment, and lifestyle. What we know and don't know. We now have a lot of data about prostate cancer outcomes in Black men, says Kos Yumoa, MD, PhD, a radiation oncologist at Moffitt Cancer Center. And this may help us provide better treatment.
And this is what epidemiologists do. They're the ones that track a lot of this data. They're the one, if you look at a lot of epidemiology programs, especially at the doctoral level, you need to know programming languages. A lot of what they use is Python, R, and SAS.
Yep. Still, research in African Americans is lacking. In some cases, researchers haven't even reported the race or ethnicity of men in their prostate cancer studies. When they have, fewer than 5% of those who've taken part are Black. You can partly trace this low participation to what's required to enroll in a trial, such as lab test results. Normal lab results are often based on a group that's not diverse, Mahal says. But what's normal can differ across race, gender, and age. And when studies are done mostly in white people, it's hard to tell if the results apply to others. Black men don't just get the disease more often than white men, they also tend to get it at an earlier age, and their cancer tends to spread more quickly. A prostate cancer starts at age 40 and spreads by age 50 is unlike one that shows up first at age 70. One you never have to worry about, says Yamor. Genetics also come into play with prostate cancer more so than any other type of cancer. Part of the difference in prostate cancer rates and therefore deaths may be due to these inherited factors. Says Lorelli Musi, SCD. I've never heard of SCD before. You know what that is, Dr. Felix?
No, I'm not too familiar with that designation. That's kind of weird.
Maybe it's misspelled or something. An associate professor of epidemiology at the Harvard School of Public Health.
There you have it.
Epidemiology, huh?
There you have it.
Well, what do you know, Dr. Phoenix? A barbershop is better. A barber is better than that. So
there you have it.
What man was this? Early detection is important for everyone with prostate cancer, but Mucci says Black men face unique barriers when it comes to diagnosis. One hurdle for Black men is lack of access to insurance and medical care, Yamoa says. Another is the fact that their tumors tend to start sooner and spread faster. Even their cancer is the slow growing type. Black men have twice the risk of death as that of other races, although it's still small. Screening can save more black lives than it can for those at lower risk. When prostate specific antigen (PSA) screening tests began in the 1990s, death rates fell the most for Black men. Early and frequent screening is critical because of the strong link between midlife PSA levels and the risk for Black men of getting aggressive prostate cancer. These are the American Cancer Society guidelines for higher risk groups. Start PSA at age 45 for African Americans and men who have a father or brother who had prostate cancer when he was younger than age 65. Start PSA at age 40 for men with more than one close relative who had prostate cancer when they were younger than age 65. For white men whose PSA levels are above normal, doctors usually choose active surveillance or watchful waiting. With repeat PSA tests, rectal exams, and biopsies, they can check for signs that the cancer is growing. This approach isn't used as much with Black men because the risks are much higher. That may be changing. MRI-guided biopsies and genomic tests can now help rule out a cancer that is spreading more quickly. Taking more tissue samples with a saturation biopsy is another option. This type of biopsy takes 20 or more tissue samples in one test compared to the usual 12 to 14. If you're a Black man, the biopsy technique is crucial. That's because your tumor will tend to sit in the front part of the prostate, says Mahal. This zone tends to harbor more aggressive cancers, but standard biopsy techniques often miss them. If these newer tests point to a low risk cancer, I think it's safe to then use active surveillance, says Mahal. Studies that follow patients that take this approach will help doctors have a better idea. We know that Black men have delayed diagnosis and therefore treatment Mucci says. They also tend to get different types of treatment, and their access to care is different, she says. Yamoa cautions that we're not asking doctors to treat Black men with prostate cancer differently. We need to treat people based on their biology. We still don't know whether certain prostate cancer treatments work as well for Black men, Mucci says. But Mahal points out that in radiation trials where patients had the same disease status and equal access to care, Black men actually had a better prostate cancer survival rate than others. He adds that their overall death rates were higher, but that this may have been due to having more than one illness. What you can do, lifestyle changes can help lower your risk. Exercise, maintain a healthy weight, cut down on red meat and alcohol, and quit smoking. If you're an African American man, do these things too. Push for early, frequent prostate cancer screening tests. Ask your doctor about tests that may better spot prostate cancer in Black men. Find out which test and treatment your insurance covers. Learn about your treatment options. Partner with your doctor to get the best, to get the early best, very best results you can. Enroll in prostate clinical trial. Dr. Phoenix, what's your take on all of this?
I agree with everything that was said. Absolutely. Here's the thing, and I don't know if maybe Salchi wants to talk about this, but
Yeah, that's fine.
yeah, we had a conversation earlier, and I talked about the key to cancer is in screening and prevention.
Mhm.
And so early detection is the key to cancer. Typically, once cancers are discovered, in many cases, especially as it concerns Black men, because prostate cancer is a big one, it's probably the biggest one. I would say a very close second is colorectal. And again, you know, much of what happens is that you don't see a lot of efforts made in prevention and early detection or screening Black men for early detection of prostate cancer. And so oftentimes what happens is that when Black men get diagnosed with cancer, they're diagnosed in later stages. And oftentimes not only are they diagnosed in stages, but they have more aggressive forms of the disease. And so you can there's tests that they do. So you do something called a positron emissions tomography. It's a scan. They use it for a number of things, for the presence of Alzheimer's, but they also use it to test whether or not cancers are spread, because on a PET scan they show up as really bright red. And so because cancer cells in general have a higher metabolic rate than normal cells, meaning that if you were to see it, you can literally see them side by side next to a normal cell, where they're literally taking up all of the glucose, for example, from that normal cells should be getting. Cancer cells will take it up, so they have a higher basal metabolic rate. Therefore, they show up, as bright red on these PET scans, and that's one of the reasons why they tell people, you want to kind of lay off on the sugars. You want to kind of really change your diet and lay off on the sugars if you have cancer, because they fuel cancers in a sense, because they will take up all those sugars from normal cells, which means those normal cells don't have access to sugars, so that they can go through a healthy Krebs cycle, and therefore, because there's the normal cells are starved out, they eventually die, allows the cancer cells to proliferate, so on and so forth. But I say that to say that, when it comes to prostate cancer in Black men, that was that article I sent you guys about a couple weeks ago about the John Herianism. That came off a project that I was assisting some researchers on with prostate cancer and metabolic syndrome, because in the article it talked about the men who where their outcomes, where they had a similar access and their outcomes were the same, but there were still those who they still had higher death rates, but it was related to other illnesses. What they really mean is that there were comorbid conditions in these patients, meaning that they didn't just have cancer, they probably had heart disease, diabetes, something like that. So, and that's what comorbidity means. It means cluster of diseases that lead to your death, that can cause death. And so understanding that for Black men, oftentimes when they have prostate cancer, it is oftentimes the end result of just a number of other health issues happening with them, whether it's diabetes, which is one of the common ones, cardiovascular disease, um, being overweight. All of these things contribute to the development. I've talked about this before, where part of the project that I worked on was actually dealing with metabolic syndrome and understanding how that can influence prostate cancer remission. Because typically, whenever you're dealing with treatment for prostate cancer, it usually involves surgery and radiation. And so occasionally they'll do chemotherapy, but most likely it's surgery, radiation, and they use what is known as androgen suppression therapy, because prostate cancer is a hormone mediated cancer, meaning that having high levels of testosterone makes it proliferate more, actually feeds it. and so suppressing testosterone is part of the treatment of prostate cancer, along with removing the prostate and obviously radiation. And so personally, I'm not the biggest fan of removing prostate, because most men that do have their prostate removed eventually become impotent.
Yeah.
And so yeah, you might be cured of your cancer, but your equipment doesn't work anymore. And obviously that's a huge factor that really affects a man's overall confidence, you know. And so no matter what age you are in that spectrum. And so understanding that the best way we're going to fight prostate cancer for Black men is how to engage in early detection. So one of the part of the conversation Salchi and I were having, we were discussing just, Black men, the CDC guidelines for when men should start getting PSA testing and digital rectal exams are usually around 45. I recommend Black men 40. And I was actually, I was having this conversation, as I was explaining to Salchi earlier. I was having this conversation with TPOT about a week or so ago on his channel, where I was certainly recommending that black men start at 40 getting PSA testing and digital rectal exams. Again, when you're talking about digital rectal exams, Black men get real childish and get real squeamish, because the general rule of thumb, or at least how Black men tend to approach it, is that, oh well, nobody's not putting no fingers in my whatever. and you don't need to and really there needs to be a more of a mature approach to how you want to deal with this, because again, it's long been known that Black men are 3 to 4 times more likely to get cancer than white men, and twice as likely to die from it. And so if we know that the CDC guidelines are recommending 45 for men to have PSA testing and prostate exams, I always, like I said earlier, I always recommend 40. And I recommend 40 because every Black man that I've seen that has had prostate cancer that was young was just past the 40 mark.
So would the testing be annually, or it'd be more?
Yeah, you can get tested annually. So what you do, so how it goes is that whenever you should have a primary care provider. So this kind of goes to what they were talking about: having health insurance and access to healthcare. So if you have a primary care provider that you should be seeing yearly, at least yearly for a wellness appointment, you should be requesting a PSA exam. And I mean, not, excuse me, a PSA test. It's a simple blood test. They most likely, if you are going to see a primary care provider, they're probably going to do a blood test anyway, but you want to make sure you let that primary care provider know, yes, I also want to have my PSA tested. Because again, this is where it comes down to. Once you start to look at those, those numbers, what they come back, typically a normal PSA would be somewhere around 1 to maybe 2.5. And then from like 2.5 to about 4, that's kind of a concern area. Then once you get over 4, then it's usually that's where they start to get concerned about the development of cancer. And then your primary care provider might recommend a consult for you to have a prostate biopsy.
Interesting.
And so one of the things to keep in mind is that every Black man, at least at the age of 40, should be having a PSA done every single year. You should have access to a primary care provider, and you should be requesting this. So now, unfortunately for a lot of Black men, what happens is that this kind of goes to this John Henryism paper that I sent you guys about a couple weeks ago, where a lot of brothers would typically have issues like, for example, they have prostate issues. Like sometimes you feel like you have to go to the bathroom, but then you try to go and nothing comes out. Usually, most likely a prostate issue.
Is that urine or is that stool?
No, just urine. If
No,
you go to urinate,
no.
you feel like you have to, you feel like you have to go, but you try to go, but you go to, you go to urinate and nothing comes out. So, so that's typically a prostate issue. But also in general, just prostate enlargements. It happens to the vast majority of men. We're talking like 90% of all men will experience some form of prostate enlargement as you
Yep.
get older. But typically, if you experience it like in your early years, in your 40s, that's usually a sign, it's usually a preliminary sign of there may be some pathology happening within the prostate that could lead to cancer.
Now, thus far, from my understanding, I know gene expression wise, I know that is associated with BRCA1 and BRCA2. So,
That's breast cancer.
oh, that's breast cancer?
Yes, that's breast cancer. Yeah.
Okay. So, if you don't have healthcare, I mean, can't they still go to like I forget the lab, like a local laboratory, just get your blood test and send it out?
Yeah, you maybe, yeah, you should probably be able to go to just a regular laboratory and just get your blood test set out. But you shouldn't have to do that if you have a primary care provider. That's part of.
Well, I mean, I brought that up. I mean, because they're saying, the typical African American man doesn't have health care. So
Doesn't have health coverage. Doesn't have healthcare coverage.
oh, coverage. Okay. So I mean, as far as I'm concerned, because I mean, if you got money to, buy liquor or blow it on women, I think you can, hold off once a year and spend that money on this. That's just me. It's very simple.
Most black men that I see, and I think Dr. Phoenix has talked about this in the past, they are more likely to avoid going to see a primary care physician as opposed to black women. Black women are more likely to see their PCP because they have to. They have OBGYNs and all types of things that go on down there that need attention. It's unavoidable for them. For a lot of black men, they just kind of avoid it. You see them out there drinking muscle milk and things like that, thinking they're getting it in, but they're taking care of themselves. Self-medication is what they try to do.
Yeah, and I think that's a huge part. Like I said, that goes back to the John Henryism paper that I sent you guys, where black men will just work through the problem, and then now here you are, 45, 50 years old, and now you have all these health problems, and now you got enlarged prostate. Could be related to cancer, could not be related, could be completely benign. There's a condition called benign prostatic hyperplasia, or enlarged prostate for short, where the prostate becomes enlarged, and usually there's various things they can do. They can do surgery. They can there's medications they can give for that. However, medications aren't necessarily most effective for dealing with that, but that's neither here nor there. But as a whole, prostate health is one of these things for black men that we don't take into account. And the reason why is because, I kind of make I've made the joke and, over the months about, men in their 40s looking like they're in their second and third trimesters. And because you have all this fat around your waist, a lot of brothers don't understand a lot of the fat that you see around your waist is also proportional to the fat that you see around your prostate. So why being in shape is such a, why just not even, I mean, you don't have to be a marathon man or anything like, Ironman competitor or anything like that, but, just being in shape and having a slim circumference, if you will, why that is so important. Because again, if you have a lot of fat around your waist, around your abdominal area, which is where most of the fat cells in men are at, it's most likely going to be around your prostate as well. And
Yeah.
so,
Doctor,
what's that?
I forgot to ask you during the conversation because I did read a lot of medical literature, and I did read a lot about there was a misunderstanding that they were saying that the testosterone actually doesn't cause prostate cancer. So I forgot to ask you what you thought about that because I read a couple on that, and they're saying because of that, a lot of guys are being they're not getting the correct treatment, especially with reducing testosterone.
Mm.
So I wanted to know what you thought about that, obviously, because you're a medic,
Yeah,
medic.
so I mean, I have read studies on that. I mean, a lot of studies seem to be somewhat inconclusive in that regard. Like they're
Yeah.
they're not entirely certain whether or not the testosterone is or is not feeding the growth of prostate cancers.
Yeah.
However, the reason why androgen suppression therapy, androgen just is another name for just testosterone.
Yeah.
The reason why androgen suppression therapy continues is not necessarily because it's profitable by any means, but because there is correlation between having lower testosterone levels and sort of lowering the risk for the cancer coming back, as well as sort of not feeding the growth of the cancer. And so, I mean, there is research to support that. I have
Yeah.
read literature, as you were saying earlier, in regards to whether or not testosterone, reducing the levels of testosterone within the body would be effective at treating prostate cancer. But they seem to be fairly inconclusive. I'll say that much if that answers your question.
Yeah, it does because I was reading, both sides, and I'm saying, well, okay, well, as we age, our testosterone does, decrease naturally. So if that's the case, and basically once you hit 40 and then 50 and 60, the chances of you actually having prostate cancer increases. So I'm thinking, okay, is there a correlation with the fact that as a man, the testosterone is pretty much our life force, what actually really makes us a man. So is actually losing it the problem? And also, as you can see in the last couple of decades, and with this push of changing men into women and women into men, we're seeing these cancer cases increasing. So I'm seeing correlations there, but obviously I'm not a doctor, or
you're right. There are correlations, but I would say there's a couple things that happens as you get older. So testosterone decreases, but what happens to most men as they get older? They gain weight.
oh yeah, yep.
And so if you're gaining weight with the reduction in testosterone, you can see where the risk doesn't really change.
Okay, yep.
So, and in relation to even with men and women, there's a lot of studies that have shown that in fact in men, by the time the average male hits about 50 some years old, he has more estrogen in his body than a woman does.
Yeah.
And just understanding that estrogen of itself further further suppresses the effects of testosterone. You can kind of see where that's going.
Oh yeah.
Yep.
So you get fat cells. So fat in the body converts testosterone to estrogen, and so you consider that with the fact that gaining weight and fat cells in general can suppress the activity of testosterone, which you need testosterone also to actually help mediate sugar levels in your body for men. Testosterone is key in regulating sugar levels in the body. That's why guys who work out, even if you're older, you can still have high levels of testosterone, but you can also have low sugar levels because again, sugar helps men to regulate their testosterone levels. So that's typically why you see that key age for where many black men are starting to develop diabetes in their 40s, because that's typically once you hit 40, that's typically when testosterone starts to taper off.
Isn't that around the same time period as andropause? Is what they call it?
Yeah. So that would be true.
Hey, Dr. Phoenix, quick question. Can you elaborate a little bit more on the sugar piece with cancer? Because some of my nuclear medicine texts were it kind of explaining this to me, how basically cancer, I guess, like you were saying, it eats that glucose. And I look at, Black Americans, we consume a lot of sugar.
Yeah.
Yeah. So what happens with cancer with the you guys got to pay me for giving out a damn biochemistry class. So what happens right here, what happens with sugar, what happens with metabolism as it concerns cancer versus a normal cell is that cancer biology, their metabolism, we're talking is like 10 times that, 10 times that of a normal cell. So if you were to look at a PET scan in real time of cancer cells, and you can actually find videos of this like on YouTube or even on the internet, where you can see it in real time, where you can see sugar that's surrounding the cells, surrounding the cancer cells and the normal cells, and you can just see the cancer cells just sucking up in seconds. I mean, not even a second. I mean, it's literally as fast as you can blink your eye. They're sucking up all the sugar, so they're starving out normal cells, and you can see all that activity on the PET scan, which is why they grow. I mean, excuse me, why they glow a bright red if you were to look at it on the PET scan.
Yeah, because typically, like nuke med, we call it the hot spot.
Yes.
Okay. So I understand, like now, and I just learned about this condition a year ago, ketosis.
Yeah, ketosis. That's where you have ketone bodies that are formed as the response to lipid metabolism. So instead of metabolizing glucose, the body metabolizes lipids, so fats. And the byproduct of lipid metabolism is ketone bodies. And that's how you get a condition known as, if you're that's what they call type 1 diabetes. They also call it ketosis.
Okay.
So that's how you get a condition called a life-threatening condition in diabetes, type 1 diabetes, called diabetic ketoacidosis. And because what happens is that because the blood sugar levels are getting so high, and the body does not recognize insulin, the cells do not recognize insulin, so then it burns fat as a fuel source, and the byproduct of that fuel source burning fats is ketone bodies.
Okay.
And that raises the acid levels of the body, so your body's pH goes up.
Okay.
Hey, no, you go.
No, I was going to ask, how familiar are you with proton therapy?
I'm not too familiar. That's definitely something in the realm of the radiation and nuclear folks.
Yeah. So here we happen to have a proton therapy center, and the reason I even know about this, there was a gentleman I know. He was getting treated for his prostate, and so now it's a place I take my students to on a field trip. So instead of using standard radiation like we normally would use, like gamma rays, they're using the actual protons to treat, a lot of different cancers, because it has a much higher success rate and it doesn't destroy as much of the surrounding tissue.
And it makes that, it makes a lot of sense, because that is the problem with cancer therapies, is that it may kill the cancer cells, but then it destroys all the normal cells. And what happens is that if you don't kill the cancer stem cells, so where the cancer, if you don't kill the very cells in which the cancer originate from, the cancers will grow resistant to those therapies, and so they come back more aggressive than ever. That's what typically happens with folks who have cancers that go into remission, but then they come back and then they're non-responsive to any treatments. Is because the previous therapies essentially made those stem cells immune to those therapies, and so they're non-responsive. And so now you done destroyed the immune system, you destroyed the normal cells, so now your body has no defense.
Mm-hmm.
Now, what I wanted to state, I just wanted your opinion on this, as you were stating, especially in that mid 50 range, for men, especially Black men, with the fat and of course glucose. Insulin. Now, what I understand, what I've read, and hopefully I've understood correctly, there are the estrogen receptors. There's a whole lot of them. It's pretty much damn near everywhere in your body. Am I right about that, or?
Yeah, there's receptors for everything in your body, everything from opioids to even the compounds that cannabidiols. So like this is a special one for complex. Your body has receptors for oh my God, I can't pronounce the word today. Cannabidiols. And
Okay.
so there's receptors for testosterone, receptors for insulin, receptors for adrenaline. I mean, you have receptors in the body for just about any substance that can have an effect, or I should say, a hormone.
Yeah, and that's all running through the blood. And of course, if you have more fat, I'm assuming, I could be wrong. If you have a lot more fat going on there, then obviously that's really not, as a man, that's really not going to, help you out, especially as you have less testosterone at a late as you get older. Or am I understanding this improperly?
Yeah, so what happens as you get older? Again, testosterone production decreases, but
Yep.
then men typically gain weight.
Mm-hmm.
Plus you have rising estrogen levels, plus weight gain, which converts
Yep.
more of the testosterone you have in your body to estrogen.
To estrogen. Yeah.
So now you kind of see these cascading issues
Yeah.
that can ultimately lead to cancer development. It's not that
Yep.
necessarily you need to have high levels of testosterone to have prostate cancer development per se.
That's right.
Just being unhealthy in general can lead to that.
Yes.
Like I was saying before, because men in general tend to have most of their fat in their circumference and in their abdominal waist area. Again, it is proportional to the amount of fat that you also see, which is why oftentimes men who are overweight, they also have fatty liver disease.
Yep.
So, and again, your liver is your main site of metabolism in the body. So, again, this is why when cancers like prostate cancer spread, they may spread to the bone. Or sometimes they spread to the liver, to the stomach, even to the intestines at times. I mean, and once typically, once prostate cancer spread, they are virtually untreatable. I mean, and
Yeah.
the unfortunate part is that for a lot of for Black men in general, early detection really truly is the key to saving your life.
Yep.
Because prostate cancers, under most circumstances, prostate cancers tend to be slow growing.
Yeah.
They although Black men have been known to get more aggressive forms of it, but in general they're known to be somewhat slow growing, which is why men can have it for years, not even know they have it, not even have any real symptoms, or even it might even develop much later in your life, in your lifetime. So you can be 70 or 80 years old and develop it.
Hey,
Yeah,
Dr.
I was reading like 15 years sometimes.
Yeah.
Hey, is there any link to with prostate cancer in certain dietary requirements?
A link. I wouldn't say you asked me. I'm thinking a link to a website. I'm sorry. I mean, I would say yes and no. I'm not giving out medical advice, but my personal opinion on it, I've seen some literature where people have suggested that if you came back and you had an elevated PSA level, so let's just say something over 4. I have seen some literature where just putting men on even a vegetarian diet for like a month or 2 was enough to get those PSA levels down. So I mean, there certainly is a major component to, I think, diet and that. Nothing wholly conclusive, but I have seen some studies where just having men just kind of even go vegetarian or vegan has been enough to get their prostate levels back to normal.
Right. Okay.
How much is prolactin, the levels of prolactin play in this as well?
Prolactin?
Yes.
Well, generally, prolactin is, I mean, it's used for a lot of things. I think we probably more or less hear about it when it comes to women because it's used. It is what tells the body to make breast milk. But I mean, it has such a wide use. I want to say.
Mm-hmm.
How can I put it? I mean, it is involved definitely with with for men getting erection with your libido. Um, it could it could potentially be involved um, with sort of benign tumors, specifically in your pituitary gland, but nothing that I know is specifically related to prostate cancer that I can tell you.
Okay.
I can confirm the pituitary gland issue with prolactin. I've actually had that personally, so that one is a real thing.
Yeah.
As a matter of, Mike.
No, I was just going to say that because I had my lab results in September, and it's prior to that September 2018, my prolactin levels were massively high for whatever reason. Never been like that before in my life, and then recent results show that the prolactin levels gone back to normal.
Okay. I would probably suggest, man, getting a MRI of the brain, particularly of the pituitary gland.
I did. I had 2 MRIs.
Okay.
Nothing was there.
Okay, then you're good. Because I actually had what's known as a microadenoma on mine.
Mm-hmm.
Mm-hmm. And mine was definitely secreting prolactin. Come to find out, I was actually starting to grow breast tissue of all things. And this happens about 10 years ago. One day, my daughter, she came to me. She was like 6, 7 years old, and she hit me in the chest. And I mean, man, I had tears coming to my eyes. This thing was so painful.
You press any charges?
Oh my God.
Oh man.
But that's how I found out what my stuff was going on. Then I got the blood work done, had the I had to go get a breast ultrasound, had to get a mammogram.
Yeah, believe it or not, men can get breast cancer.
Oh yeah.
Mm-hmm. A lot of folks don't think it's possible, but men do get breast cancer.
Oh, absolutely.
Yeah. Start showing up at their events, man. Susie Corman or whatever her name is.
Yep.
Speaking of prostate cancer, I'm gonna address something that Jeff Rugeta said in a moment, but well, speaking of prostate cancer, do anybody here knows what is the official month for prostate cancer?
September, I believe.
Exactly. And right after that, October is breast cancer awareness month. Mm-hmm. But most men don't even know that prostate cancer awareness month is September. But a lot of the effort, a lot of the attention gets put on to breast cancer. But for black men, not I don't want to say black men, but men in general, prostate cancer is an issue, but certainly more so of an issue for black men. And so, you got the NFL running around in October wearing pink cleats.
Yep.
In September wearing something, I don't know, maybe blue for men or something like that.
Yep.
Yeah.
So, there's very little attention given to the fact that, prostate cancer has been a very consistent problem and among men and certainly among black men for decades. My grandfather died from prostate cancer and he had it for maybe about a decade. And he was in his I think he was like 80s in his 80s or something like that. And when he died, and and I remember, he was a World War II veteran, and I remember when I found out about it when I was a kid, he was terminal. They gave him about 3 months to live. Actually, it was like November of the year we found out. He was dead that January. He was dead like 2 months later in January. So I mean, this is one of these issues where the attention it should have a lot more attention than is given. Mm-hmm. And certainly these sports entities where you have a majority male and certainly a majority black male should be given goddamn attention to the fact that it's your fathers and your grandfathers and your uncles that are the ones that are being killed by this disease.
Mm-hmm. Yep, facts.
And so, that's kind of my pet peeve because I see this every year. You go to see the skylines of these cities, they're lit up pink during October for Breast Cancer Awareness Month. And yet the month prior to, nobody didn't give a damn about the fact that it's prostate cancer, and prostate cancer absolutely ravages. And the interesting thing about breast cancer, A lot of black women get the really aggressive form of breast cancer, the triple negative. Those are pretty much the ones that don't respond to just about any treatment. And so, this is this is something that yeah, you know, there has to be more awareness about prostate cancer and then what happens, and how it affects black men. And just in general, when you're dealing with a lot of many of these metabolic disorders that can lead to it, you know, what Johnny Blaze was just describing what happened with him. Pituitary gland, the anterior pituitary gland, you have the thyroid. I mean, these are some of your chief regulators of your endocrine system.
Yep.
And understanding that, dysfunction in them, dysfunction in these dysfunction in these particular glands can cause any number of issues. And a lot of times, we think a certain condition is caused by one thing, but it can very much be something else completely unrelated. And so I just say that to say that in general, understanding that in the body is this one machine and it all works synergistically. So if you have dysfunction in one area, you're probably going to have dysfunction in other areas. And so again, as it pertains to black men and prostate cancer, understanding that being overweight, having a lot of fat in your abdominal area is one of the major indicators of probably fat around your prostate. And the fat in of itself acts as its own gland. It can secrete cytokines, it can secrete various inflammatory enzymes, and all of these things can cause inflammation in the body, which can ultimately affect gene expression and lead to development of cancer. Because remember, cancer at its core is a genetic disorder. At its core, and some people classify it as a metabolic disorder, is more or less a genetic disorder. And the reason why you have such high death rates and high mortality rates. I mean, prostate cancer doesn't traditionally produce high mortality rates. I mean, lots of men die from it, but it's not as high, let's say, something like pancreatic cancer, which John Lewis was just diagnosed with about a week or so ago. Or you think about your various throat cancers. Your throat cancers have really high mortality rates. And so you think about cancers like liver cancer, another very high another cancer with high mortality rate. And just understanding that, all of these issues, at least, let me reverse back. The other one, colorectal cancer.
Yeah.
That's why I was not remember it. Yeah, colorectal cancer. Because the talk shouldn't just be prostate cancer among black men. It should be also colorectal. Because if there's any other cancer that's, literally nipping at the heels of prostate cancer for issues within black men, it's certainly colorectal. And understanding that that in general, the reason they have to do whole genome sequences of your cancer is because physicians understand that, and that every single treatment and medication, a person might not respond the same way just based on your personal genetics. This is why I've been preaching now for a long time that brothers really need to get into the field of genetics, because this is the heart of cancer research, is genetics. I mean, you see stuff like gene therapies being developed and all this stuff. The problem with cancer is that you have too many genes within that codon that are goddamn mutated. So a gene therapy may target one specific gene, but you're not dealing with the thousands of others that are mutated. So, I mean, this is something that, it has to be an issue around whether or not that black men are just, black men are being made aware of the issue. There's more attention being put nationally on this issue. But also, too, understanding that black men are going to have to be invested in saving themselves, not to sound cliche here, but but there has to be an investment in producing black men that can be the geneticists of tomorrow. They can start to do this research and really start to figure out why is it that black men seem to have this higher sensitivity to the development of prostate cancer as opposed to other groups of men. Because again, as the article read that Mike was reading off, black men are hardly represented.
Yeah.
In the research, in the clinical trials, hardly.
Mm.
You can't. One part is you can't get them to show up. The other part, not even interested.
Yeah, it's as Dr. Phoenix and I was talking earlier. I mean, even I've noticed, even in my personal life. I mean, you try to champion anything positive with men, or especially black men, and it's just weird how women, not really a lot of women, but a lot of black women, they will like attack me, and I'm not even talking about them. You know, I'm talking about just black men, just being healthy, succeeding in their careers and all this other stuff. And if they start talking about breast cancer, this, that, and the third, and I know the numbers, and I'm like, well, men actually, more of us die from prostate cancer, and like they don't want to hear it. And it's like, all right, so after all these years, I'm like, well, black men we're gonna have to do it ourselves. I mean, it's very inclusive that nobody gives a shit.
Well,
Actually, I do want to address some. Go ahead, Mike. Before you go ahead.
no, go right ahead. I was gonna, address King Damietti's question in the chat.
I'll go ahead, and I want to address something that Motown and Jeff put up.
Okay. Can the doctor speak on the blood types in relation to promoting a healthy diet? I got my blood type tested by Dr. Sebi, a herbalist, and was told certain foods that my body can and can't digest properly based on specific enzymes in my body.
Here's the thing.
Mm-hmm.
The reason there's not a focus on that, or I want to try to say this as respectfully as I can, is because research is very inconclusive on whether or not there are certain foods that have specific outcomes. And typically, when we talk about enzymes that don't allow for proper digestion, really, at least when it pertains to black folks, the big one is probably the fact that most black folks are lactose intolerant. You have about 3/4 of black people that are lactose intolerant because they lack the enzymes to properly metabolize lactase, which is the milk sugar. Um, I will be honest with you, man. I don't know too much about that to be really certain with you. Um, I'm not so sure if that really even gets discussed in modern medical literature to an extent. I think that's something that kind of extends itself more to more complementary, holistic types of medicine. And not to knock it, but they better produce some hard evidence to show why these foods work and don't work. I would need to see some hard evidence. Some longitudinal studies or some clinical trials or something. You know, so not to not to throw shade, but until I see something that truly looks, so I see some data that really suggests that there are certain types of foods that folks can eat outside of the ones we already know that are bad. That we don't have the enzymes for. I don't know. You know. Was there another question you want to answer?
Oh, that was it. That was it.
So I don't know if I don't know if that can be a lot of help to you, King Damiette. But I did want to bring us on. Earlier, Jeff put up a comment talking about ketoacidosis and how people have sweet smelling breath. The key indicator of someone that has diabetic ketoacidosis is what we call fruity breath or acetone breath. So if anyone's familiar with acetone is nail polish remover. And typically people who one of the principal ingredients in acetone is actually ketone bodies. That's why they have that fruity breath, because those ketone bodies are combined with carbon and produce acetone. So CHOO. And so CHOOC, excuse me. So what happens is that for folks with acetone breath, you can typically smell them when you're pretty close to them. they'll talk, and it has it's a very distinct smell. Put it that way, so you'll know it. For Motown, I would have to say, brother, I disagree with uh, your comment about West Africa, because if you look at the literature, the highest rate is when you start to subdivide black men with the highest prevalence of prostate cancer are actually West African men. And it's been long known that West African men do tend to have the higher rates of prostate cancer. And when you start to subdivide the groups of black men, so I would just say that much to answer to what you said.
Hey, Dr. Phoenix, I just pulled up this chart. This is from on prostate cancer death. This is back from 2014.
Mm-hmm.
And it's based upon the 50 states. And according to this, for death rates, the District of Columbia had the highest at 31%.
This is just for all men or black men in general?
Now, this is just all men in general. But this is looking at just going like, so, and I'll just name like the first 5. It goes District of Columbia, number 1, Idaho, number 2, North Dakota, 3, Alaska, 4, Mississippi, 5, South Carolina, 6, Georgia, 7, Louisiana, 8. Those are the top 8.
So, yeah. So if you look at all the states minus DC, Idaho is far west, out west. North Dakota, upper Midwest. But specifically, if you look at the other states minus DC, they're all in some of the states that are the most economically deprived.
Right.
Where people have the least amount of access to healthcare. I mean, Alaska is fairly remote, so
yeah,
they do have somewhat of a difficult time attracting providers up there, which is why Alaska tends to pay some of the highest salaries in the country for like physicians, for primary care docs, nurse practitioners,
right,
stuff like that. I would say with the DC, because DC is kind of somewhat the anomaly because it's kind of in the middle of a major metro, and I would probably say, when was that? Was that over the last decade or so?
That was from 2014. It's just something on in the Men's Health Library that happened to pull up. But there are actually 2 charts. So one is by death, and the other chart is by invasive cancer incident.
Yeah.
Now that one it changes up. But some of the now Louisiana's number 1 for incidents. District of Columbia is number 2. But then it goes to Maryland, New York, and Delaware, and Mississippi.
Yeah, so it's kind of, I mean, Mississippi, Louisiana, right next to each other, and those states, they're kind of regularly trading back and forth for the states that has the worst health outcomes in the country.
Right.
The highest rates of obesity, the highest rates of illiteracy. I mean, you name it. You name every metric of health and quality of life in this country. Louisiana, Mississippi trades places going back and forth between the number 1 spots.
So I would assume that you're a big proponent of also checking not only lab and blood work, but your body fat measurements.
Yeah, because I mean, body fat has long been known, especially when you're dealing with hormone mediated cancers. Body fat disrupts normal hormonal activity. It disrupts normal. That's why, for example, you see a lot of women. This is why you see women who are overweight, where they tend to have thyroid issues, because fat disrupts hormonal activity. It can interfere with the synthesis of a thyroxine.
So one of the issues that seems to become is how to actually get your body fat measurements done. I know about 4 ways of doing it. There's the underwater weighing, there's the bod pod, there's the DEXA scanner, and I think there's an electro method.
Yeah, I'm not too familiar with the electro or just those methods in general, but I will say this much. I think whatever method you use, definitely having having your body fat percentage measured is important, no matter which method you use.
Okay. Yeah.
Especially considering the fact that, just being overweight in general leads to a number of problems. This is why, you typically see higher rates of, whether it's diabetes, because again, diabetes, for example, when you're overweight, um, having a lot of fat around your organs and your body in general actually makes you more insulin resistant. So your cells become more resistant to the effects of insulin.
Okay. So I think with the body fat measurement, I think one of the biggest issues really is access to where you can find these machines.
Yeah, if you have a primary care provider, they should be able to help you find ways to get your body fat measured.
Yeah.
They should certainly have access and have the ability to get your body fat measured. Certainly, especially when you're concerning those that are, clinically obese, clinically, morbidly obese.
Right.
They should have access to those methods.
Because what's interesting is when I was back on active duty, we actually use our DEXA scanners primarily used to check for osteoporosis. Well, it's got a secondary function. It can do a full body scan, and it can scan your actual body to muscle ratio. So I discovered something in doing this is there are a lot of what I call the skinny fat people.
Oh yeah.
And
Yeah.
I mean, you're talking like guys who weigh like 150 pounds, 160, but they have body fats that's around 30 and 40%.
Yeah, and we have use that term too, because a lot of times you see these gentlemen, they could be like 140 pounds, but these guys have cardiovascular disease.
Right.
They have hypertension. They have diabetes, and so there's a lot going on with them, but also a lot going on with trying to understand really what's happening with them, sort of not just physiologically, but just really genetically.
Okay.
Oftentimes, what happens is that I would be looking at some family history, because you see this a lot. You see a lot of Black men who you think otherwise, just based on appearance alone, they're kind of thin, wirely looking. You would think that they would be relatively healthy, but in reality, no.
Yep.
Yep.
Fatty liver problems, all other stuff.
Oh yeah.
Yeah, I think it's something that there's something to be said about. I know Mike has done previous streams where he talks about his exercise regimen. Was some Nagone has talked about his, and I think Cocaine has also talked about what she does as well, and why those streams are important, because again part of what I truly believe in is prevention. Prevention is one part. One, it's about early detection. Two, it's about maintaining lifestyles that lead to you not having, I ain't gonna say necessarily worry about, but it leads to you having a better quality of life, where those things may not be always in your periphery.
Yep.
Where you don't have to worry about, well, yeah, I'm 5'10" and I'm 300 pounds, Lizzo.
Fat acceptance.
Yeah, going around telling people who are saying, oh, well, you're overweight, they're body shaming. No, they're not body shaming.
Jillian Michaels.
No, they're not body shaming. It is not healthy. And, unfortunately, I think this is a problem. As much as I say this is a problem among Black women, Black men, this is more so a problem among Black women, where these concepts or these ideas of what a healthy body type is and what it looks like. And having to help people to understand that no, it is not all right to be 5'10" and 300 pounds. No, you're not healthy. No, your body, you're just young and your body can compensate well.
For now, yep.
Yeah.
But once you hit that 30 plus mark,
oh, it's a wrap for them.
Yeah.
I see it all the time, man. And if you say anything, especially if you look like me, all fit and jacked, oh, hey, Black women. It's like, no, you really need to go see somebody. Like, don't you care about yourself? Don't want to hear it.
No.
Crazy.
No, it's interesting that you bring that up, Dr. Venus, about our workout regimens. And the reason why I post WODs, workouts of the day, on it, because these are actually fairly simple workouts that you can actually do and actually burn enough calories and build enough muscle without actually killing yourself. And your workouts are usually about 30 to 45 minutes. It shouldn't take up more of your day. But what I have noticed is that I have not been sick in about three years. No colds, no flus, nothing. I just get up and go.
Yeah.
What workout method was this?
If you look on the community tab, we post stuff on the community tab on the Black Brain Trust.
Oh, okay.
Yeah.
You know, Mike, I haven't been sick myself, man, in about 2 or 3 years also. I try to work out, at least almost every day, about 20, 30 minutes. Mm-hmm. Get out here, and I can't really run anymore, but I do a lot of walking.
Yeah.
And I think that and what you just said, Johnny Blaze and Mike, is very important, because again, I think there's this misconception when people say exercise, they're thinking, oh, you gotta go be a gym rat, live in a gym. But no, but if you have very efficient workout routines, you will see more, it will be more beneficial to you, which is why, certainly when we're dealing with prostate cancer, again, and which reminds me, because this is something that Sauchi and I were talking about earlier, and I'll get to that in just a moment. But just understanding that, your weight is a very huge indicator of where your health is currently at. Yep. If you're young, people, I don't know, Black folks seem to have this idea, again, this is John Henryism, that they're invincible. And it seems to be the younger you are, the more invincible you think you are. I know this tends to be something commonly thought among young people, but again, you're not invincible. We're seeing there's been rising rates of colorectal cancer among 20 somethings for years now. You're seeing 24, 25-year-olds being diagnosed with colorectal cancer. Unheard of.
Mm-hmm.
Yeah.
It was decades ago. You can imagine a 24, 25-year-old being diagnosed with colorectal cancer, but we know they're being diagnosed, but they are being diagnosed in this age, because clearly the lifestyles that are being led, the foods that are being eaten, and again, I'm not one that subscribes to where you gotta just be a plant eater, you gotta be hanging off trees or whatever, chewing on leaves. But a good portion of what you eat does have to be plant-based, to be really frank.
And it should be. It should be. It should be a part of your diet. At least one third of your day. You should be consuming some kind of plant-based source. I hear a lot of. Another thing I want to bring up too. I'm seeing a lot of young VWs walk around in the freezing winter with these too small jackets on, knowing you're cold. That jacket is so small. That's like for September. It's like January. You out there just struggling, man.
It's all about swag, man. It's all about the swag, man. No function. Doesn't matter. It's just.
Yeah, I see that here in Wisconsin, man. It's cold as hell here. Actually, in fact, we're getting a few inches of snow as we speak.
Hey, man, we had a community day at the university, potential students, man. And oh my God. You don't even.
I already know how they showed up.
Man, yeah. Oh, I'm like, them mamas, grandmamas, blue hair. Come on.
Three generation of old hoes.
Yeah. Yep.
And I all jokes aside, again, this is a fundamental problem. Again, we're, this idea of what, for black men have this really unhealthy image of what body image is. Whether it's what many black men see that is desirable body image types in women, black women,
yeah,
or whether or not you see, you know, how black men even view themselves, which is the problem, which is one of the things I was talking about with with the brother Xavier last week, where, you know, I was saying, like, if you want to see an example of brothers, where brothers just kind of just let it all go, I said, look at your athletes. When most athletes leave whatever league they're in, NBA, NFL, whatever, you know, what do? They almost all of them gain weight within the first year.
Yeah.
And because the problem is that you hide unhealthy habits with exercise and activity. So they never stop their unhealthy eating habits, you know, eating the tons of McDonald's. What was the brother name? The wide receiver, Chad Ochocinco. He talked about how he eats McDonald's like 3-4 times a day, but he doesn't worry about getting fat because he works out all the time.
Oh my God.
Yeah. Roy Jones was doing the same thing himself in his prime. Yeah. And he talked about how that was stupid.
Oh, all right.
Crazy.
Yeah, and you know, he talked, because I guess people were kind of getting on him for, you know, are you really promoting a healthy lifestyle? You know, you got all these young folks want to be like you, but you know, you're eating all this McDonald's and all this junk food. He's like, well, I can do that because I work out all every day, all the time. And it's just like, you know, the moment you stop that lifestyle, you're still going to continue to eat that McDonald's and whatever else you eat, which means that within that year, you're probably going to be one of those folks that they're talking about you're not motivating to lead healthier lifestyles. Mm-hmm. So yeah. So I mean, and something else I want to talk about, because this is something I was also discussing with both Salchi and brother Xavier last week, was Black folks do not have a damn clue about their family's medical history.
Mm-hmm. Agreed.
They don't have a goddamn clue. You go in a hospital, you speak to someone like me or a physician or a nurse, and they're just trying to get a medical history. I swear to God, man, when you're dealing with Black folks, it's pulling teeth.
Yep.
You literally, you got to coat stuff. I never heard so many I don't knows from grown people in my life.
Well, the problem, a part of that problem is a lot of Black people don't know who their fathers are. And so that side of the family gets cut off. So you don't even know, what's happening there. You know, we know that paternity fraud is massive in the Black community.
I was about to say that.
It's the highest out of all racial groups. Paternity fraud is massive. So people don't even know who their real, one half of their family.
I agree. I agree with that. That certainly is an issue. I mean, again, even within the health system, a lot of times dudes find out they're not the father because you have to go get a damn test, or the baby might pop up with some genetic condition. Then they have to test both parents. Then come to find out you ain't the damn child's father. Baby pops up with sickle cell disease. Then you're like, oh, well, we got to go test both parents to see if you're carriers of the gene. Oh, well, the dad's not a carrier, so which means he cannot possibly be the damn father.
Yeah.
So, I mean, yeah, it's crazy. I mean, all kinds of stuff, oftentimes do find out about it when you got to go get tested if you get put on child support or something like that. It's all kinds of ways. But I say that to say, because, even among Black women, I've seen this a lot too, where Black women, their mothers don't tell them their history. So this is why you see a lot of Black women, they're in their early 30s and you get diagnosed with breast cancer and don't have the slightest damn clue, how you got it. You're sitting down with your physicians and such, and they're trying to go through your history. You don't know it. You don't know if your aunt had it, or if your grandmother had it, or if your mother had it, or if your sister had it, because they won't even tell you. They just say, well, Grandma Maddie, she died of something. We don't know what it is, but she died of something. And it's just like, really? Everything has to be like this goddamn urban legend, this old wives' tale with Black folks? And it really is pulling teeth. And for Black men just don't bother to ask. And I'm gonna be really honest about this. Black fathers are doing their damn sons a wholesale disservice about not telling your damn sons about if you've had prostate cancer, if your grandfather had prostate cancer, if your father had prostate cancer, if your brother had prostate cancer, your uncle had. I mean, they're not doing their sons any service by doing this.
Well, a lot of Black men don't go see a doctor themselves, so they wouldn't even know what's going on with themselves.
Yeah. Yeah, I would agree. I agree. You know, getting brothers out to see, you know, just to see a doctor. Like I said, you know, even you know, for me, in my personal time, I have done some consulting with brothers, where you know they come to me, you know, in private, ask me about stuff, and then I say, then one of the first things I say, well, you know, well, have you seen anyone for this outside of talking to me? Have you do you have a primary care provider? Do you do you know are you seeing anyone for this particular condition? And they're like, well, no, I haven't. You know, I was seeing someone maybe about a couple years ago, but you know, for whatever reason, you know, I didn't want to go see them no more. And then just like now you have a full blown case of diabetes and you're impotent because diabetes is one of the leading causes of impotency in men.
Mm-hmm.
Um, and now you're having to now you just come to me as looking for advice from me, and I'm like, my first thing out of my mouth is like, I'm not your primary care provider. You know, you need to see them. What I do supplements whatever they're doing.
Mhm.
Hey, Dr.
Yeah,
Finney, I want to run something past you. And this is kind of back on that body image you were talking about.
Yes.
Are you familiar with the term called body dysmorphia?
Oh yeah. Body
Do you?
dysmorphic disorder. Yeah.
Yes. And this is going to sound kind of far-fetched, but do you think that might be something that maybe the collective of Black America may have?
I I I would say for men, no. Women, yes.
Okay.
Why do you say no for men?
I think because men aren't as inclined to go out and have go to extremes to get the kind of body they want. Men understand typically if I want a nice physique or the body that I want, I got to get my ass in the gym.
yep.
Or if you're in jail, you just kind of.
Well, yeah, you can do the
You
prison.
don't have a choice.
Yeah, I mean, you can do the prison pull up method. I mean, that works too. Um, versus women where most cosmetic procedures are geared towards women. So
Yep.
instead of women getting into the gym to get a flat tummy, now you just go into a damn physician's office and they got a machine. They sell machines now where primary care providers can do liposuction in like 30 minutes.
Really?
Mm-hmm.
Yeah,
Yeah.
yeah. I when I was at a medical conference the early middle part of last year, there was some folks that approached me. They thought at the time they thought I was this was before I started medical school. They thought I was a physician, but you know, I was, you know, obviously, and they was like, well, you know, are you looking to get this in your office? I'm like, no, I'm soon to be a student. And you know, they were like, but you know, it was a black couple selling this to me, you know, real nice couple, whatever, well, trying to sell this to me, I should say. And but you know, they're like, yeah, you know, they kind of going through the whole thing, showing me everything, and there was this other gentleman there. He was an internist, and he started talking to him. He's like, yeah, you know, you pick up one of these machines, you know, yeah, you can do it you can do lipo in your office, man. They be gone under an hour. I mean, I mean, this is
But it's got to be expensive. It's going to be done that fast, right?
yeah, it is. It's a fairly expensive machine, but again, you know, these cosmetic procedures like that, they're cash.
It's a quick fix for a long-term problem.
Yeah,
You know, and
because
when all they have to do is regulate what they put in their freaking mouth, what they drink, you know, instead of, I mean, everything. It's very sad, but you know, they don't want to put in the work. They rather put in weave. You know, the girl got a nice ass, but yo, her thighs are free. She's burnt. She's creating fire. She's fat. But you say that, I mean, it's like, nah, it's like, what is, they had the take the wheel mentality. And clearly it's not working.
Yeah.
yeah, I think typically, in my opinion, I think the reason you more likely to see women with this disorder as opposed to men, because even overweight men can kind of get around issues. You won't necessarily get rejected for having um, a not so great body or not so great physique, I should say, if you have enough money. Women, on the other hand, that's the first thing you see.
Yeah, I just recently learned about this condition last week. I was just like, let me And I just kind of put it like, but when you mentioned this, I kind of started to kind of put this little correlation together, like,
Yeah, I mean, again, I mean, even just, again, when you're looking at the development of disease, specifically cancers, I mean, just, for example, just talking about women getting liposuction, getting all these cosmetic procedures, you're still not dealing with the underlying problem,
right.
you know, that's always going to be the issue. I mean, again, oftentimes cancers are considered lifestyle diseases because more often than not, they're really a product of your lifestyle. So, whether you're, and I didn't touch on this, and I do apologize. The stress. This is probably one of the major drivers of. This is probably the major driver of disease, especially among Black men. I would say. In my opinion, my humble opinion, I would say stress is probably the major driver of disease. Just dealing with stress, dealing with, bad eating habits, just leading bad lifestyles, you know, um, financial, economic insecurities.
Yep.
We know the stories now. We're seeing them. I'm sure a number of us have probably have at least perceived this long ago. Housing insecurities with men, and understanding that you're having huge swaths of Black male population in some cities that are homeless.
Yeah.
Yeah.
And how all of these things come together to really affect, your overall health. And this is where the concept of epigenetics come into play, where you're looking at how you have all these different stresses and how they affect gene expression within the body. So stress on DNA causes mutations in a coding process. So whenever DNA copies itself and it codes, you get mutations in that, hence you get cancer.
And a lot of literature is coming up now that the biggest predictor of success, just across the board, health, income, everything, is your zip code. So where you live, environment.
Yeah, because if you're in proximity to people who live healthier lifestyles, you're more likely to engage in a healthy life.
That's right.
It's no different than being around successful people. If you're a moderately or maybe not even a so successful person, but if you get around successful people, it's going to motivate you to be more successful. So again, your environment is very much the thing that nurtures you.
Yep.
And that's something that that's oftentimes not considered in Black society. Even just going back to the issue around Black folks not knowing their medical history. I mean, this is probably one of my biggest pet peeves, man. If there's anything that probably annoys me more than anything, is when I'm talking to Black folks and Black folks would get into arguments with me. They would go back and forth with me. I'm just trying to figure out. You asked me for my some advice on something. I'm trying to get your advice, but I can't get enough information. But I have to make an educated guess based on vagaries.
Yeah.
I can't make a guess on something. You just expect me to guess and figure it out. And I think that's one of my big things with Black folks is just really trying to help helping Black families understand you need to be more forthcoming, more progressive about talking to your children about health issues. It shouldn't be some damn mystery as to why their damn grandmother or their grandfather died or why their aunt or whomever died. They need to know that because ultimately it may be them sitting across having that diagnosis given to them.
That's a fact. I'm personally this year, I mean, I'm very healthy. Been hearing it forever, but I'm just bypassing everybody. I'm getting my DNA tested, insulin resistant thyroid, cholesterol, body fat, testosterone, free testosterone, total testosterone, estrogen, sensitive estrogen, glucose, everything, total protein. I'm just going straight to the science. I'm not listening to anybody. Period. Pay cash. I don't care if my insurance covers it. I'm just gonna pay cash.
Yeah, and again, to go back to where we're thinking about why Black men have such desperate outcomes compared to white men, why they have higher mortality than white men in regards to prostate cancer, it really does come back to sort of socioeconomics. And given that earlier, Mike was going through, all these startups and stuff like that, you got these folks in these industries. I mean, you can see them. Many of them, some of them that were probably old enough to be my father, but you look at these dudes, look pretty damn healthy looking.
Oh man, I again, I'm in finance, so I see it all the time. Like people get it completely twisted. A lot of these guys out here who are CEOs, this, that, and the third, they are extremely healthy, and especially those in like Fortune 500. I mean, in their contract, they have to be healthy. Many of them. So you're talking about a procedure over a decade ago where they tested everything, which would cost 15 grand, like maybe 10, 15 years ago, cost between 2 and 5 grand now. And that's something they do like every 2 to 3 years. So they're not playing. But black folks, Jesus take the wheel.
Yeah. And
Hey.
what's up?
No, I want to make a comment on that on that one piece you guys did. You were talking about the whole connections, and I just wanted to re-emphasize, man, networking is so powerful.
Yes.
And you know, the job I currently have at the university was through a guy I was stationed with in the military. That's the only reason I'm really here, is because I knew him. And I was able to go bypass, got right to the front of the line. And I think that's just one of the things that people have really got to understand. You got to have a good network of people who really understand these things and really keep your skill sets up.
I totally agree. And what's very sad about that is throughout my life, the people who really ingrained that in me were white.
You know, going back to how these things play on how the development of prostate cancer in black men, and understanding that most of what happens to black men is really stress, and primarily that stress is the outcome of no socioeconomic viability, or I should say sustainability in their case, and being able to sustain what would be, I don't want to say a livable income, but have a career or business, something that allows you to live a lifestyle where you can mitigate a lot of that stress in your life. You know, even folks, I know plenty of folks that have just regular 9-to-5 jobs, and they're pretty healthy because they enjoy what they do. They like what they do.
Yep.
You know, it's not that you have to go out here and build a business. And although I think that's great, and many black men should, you know, you also have to be in careers, and you have to be in industries that you thoroughly enjoy. If you do not enjoy your job, you're going to hate it. And what Johnny Blaze was just saying about networking, he's absolutely correct. I was saying earlier, I can't remember the last time I formally applied to a damn job or anything like that.
Me either. Most of I think 9 out of 10 of my jobs in IT have come through networking.
Yeah.
Someone knew me.
Yeah, and the networking piece is just so important. And again, you know, typically if you're in these circles where you have the networking going on, people are healthier, they have healthier lifestyles, they obviously have the income, because otherwise you wouldn't be in those circles.
That's right.
And so that translates to healthier outcomes for you as black men, or us as black men, I should say.
And with black men, I normally promote, at least publicly, I tell all of them, hey man, at a minimum on the floor, income wise, you need to be in the top 20%. Floor wise, you have to, or else you just gonna have a lot of problems. I say that publicly. Personally, bare minimum 10%. Bottom 10%, whatever closest metro MSA area you're at. I mean, it just totally changes your life. Period. But you know, a lot of guys, they don't want to hear. They don't want. I don't know what it is. They're just our black guys. They don't want to hear it. They think you're like being elitist or looking down. But it's like, if I'm here with you, we're having this conversation. If I'm looking down on you, that's a reflection of myself. I'm not down. But a lot of them, they just don't want. I don't know what it is. They don't want to hear. They don't want to do it.
Dr. Phoenix. Yeah, Dr. Phoenix, there's a statement in the chat from Career Heights. Says, Dr. Phoenix, you recommend Emergen-C in one stream. I bought a pack and checked the sugar content. It was too high per pack.
I never recommend no damn Emergen-C. No, I never did that. I don't make recommendations. I've never recommended that. No.
Mm-hmm.
And if you were to take vitamin C, man, don't. If you were to take vitamin C, I would never tell you to take no damn emergency. One, I take vitamin C daily, and I tell you what I take. I use a brand called Bronson. I get it. I have a subscription service of it. I get it shipped to me every couple months from Amazon.
What's that Amazon boy?
Hey, you know what? I guess I contributed to the downfall of the big retail. Okay.
Yeah, but I would have thought that you would have just ate an orange or something,
I mean, certainly eating oranges is certainly helpful, but I just do this. I've been doing this for years, man. And it's just something I've always done, and it's been pretty damn effective for me, at least my opinion. That's something that I do. Yeah. Now, if you're going to take vitamin C, you need to take the pure vitamin C crystals, where you can mix it in with water because it's can be really acidic, obviously.
Yeah.
But that's what I do. That's personally what I do. I've never recommended no emergency, so. Because I would never tell nobody if I were to ever recommend vitamin C, I would tell you just go to a place like Amazon or a vitamin shop or something like that. They sell pure vitamin C powders that you can mix in with water that are far more effective than anything you'll find in vitamin C. Emergency, excuse me. And like I said, the particular brand I use from Amazon is called Bronson. Is non-GMO. So yeah.
Is it like Charles Bronson?
Nah. That was before my time, but I have. Yeah. So yeah. No, I'll say that. But just going back to what Johnny Blaze was saying, enough emphasis and also what Sauchi was saying, enough emphasis cannot be put on the fact that for Black men, one of the best ways to stave off stress, to live healthier lives, so that eventually men in general will have some prostate issue, but instead of it being you're 40 years old and you have prostate enlargement or even prostate cancer, it should be like 80 years old when you're more closer to the end of life, where that wouldn't be so much of an issue. It shouldn't be that you're still in your prime years of your life and you have to worry about issues like prostate. And so I'm sorry, go ahead, brother.
Oh no, you can finish. I just had a quick comment on an opinion you had.
Go ahead.
Okay. Another thing I don't hear a lot of people talking about is what's in our water, and it's not even about contaminants. It's more so about birth control. The shit does not get filtered out at the state level. It just can't be filtered out. I mean, the only thing really that filters it out is you need a carbon filter. So I mean, that's up to you. But I wanted your take on that because it does affect your body, literally.
I'll give me a second, Sauchi. I'll answer that. Do I recommend a multivitamin? I don't make recommendations, but my honest opinion, lots of studies show that multivitamins aren't necessarily all that effective. In fact, studies show that you're better off just eating a balanced diet to get the necessary vitamin intake you need.
Yeah, absolutely. Most of those multivitamin pills have not been approved by the FDA either.
Well, the entire industry as a whole it can completely circumvent FDA approval, so they don't have to go through it to be on the market. So I personally would just say that there are a lot of studies that show that, and that's typically what I go by. If you're eating a balanced diet, you shouldn't necessarily have to worry about taking multivitamins.
Yep.
But to answer your question, Sauchi, I would say water contaminants in water has certainly been an issue, especially in Black areas where Black people are known to live. Especially like where I'm at here, where lead in water is a major problem where I'm at. I can't remember. I haven't drunk tap water in years. I even if I generally drink bottled water. Sometimes if I'm feeling real nice, I might, you know, I'll buy some really nice water from time to time. But most of the time, I usually drink bottled water like Aquafina or something like that. But I just think that in general, yeah, most of your conventional methods for filtrating water are not really effective for getting a lot of the contaminants that we find, because you get a lot of, sometimes you can get pesticides into water sources. I mean, there's all kinds of things that ends up in water sources that oftentimes are not filtered through conventional means. In fact, most conventional filtering means are usually meant to really get sort of the sediment out.
Yeah. I think one time in your life, anyone's life, you should go to the sewage plant just once. I did that for a summer program. It'll change your life. Trust me. You see big tanks of all the shit, all that stuff, and then the next minute it's clean or clear. And believe it or not, it's just take it will change your life.
Yeah. Again, I think, like I say, where I'm at, lead poisoning is a problem. I mean, you get a lot of.
Wait, in a first world country, lead poisoning is a problem?
Oh yeah, especially among Black children. It is my hypothesis. That's what you see with a lot of these Black males on YouTube. You see a lot of Black males with some various levels of arrested development due to neurological dysfunction, due to the lack of neurological maturation.
Wow. And that stuff sits in your bones. So it like lead hides in your bones. So even if you get tested, I mean, you could still have more than you really actually have. And they didn't take lead out of paint until, I believe, 76 in this country. So obviously, if you're living in a poor area, which have older homes,
those homes wouldn't pass inspection today, though, if they did have it. So they wouldn't pass inspection.
Well, actually, they have what you would just paint over it, because I mean, I don't live in Rhode Island anymore, but I'm from Rhode Island, and that's part of the law. I mean, you would just paint over it, because the for you to actually get rid of the lead is freaking the price is insane.
Yeah.
Yeah, but they actually here in Massachusetts they have to remove it, so it's lead paint removal.
Okay. Yes, in Mass, that is correct. Yes, in Mass,
all the bridges in the Black community are painted with lead paint.
Yeah, because it lasts longer, but unfortunately, it's freaking poisoning you.
Yeah, they've removed all of them now. So
wow.
Yeah, that was like a 5-year project to remove all the lead paint from those bridges and whatnot.
Well, see, here where I'm at, they still have lead pipes that are used to run water through, and so obviously tap water comes through these lead pipes. And so I mean, this has been an issue known for at least the last 2-3 decades where I'm at. But also too, with the lead paint, Salchi is right. In many states, all you have to do is just paint over the lead paint. It's still there. So again, and this is what you see in a lot of these government housing, where they just kind of did some real shoddy paint over it, and then eventually, they never bothered. They do it that one time and could care less to do it again. So you have children that live in these areas, like the issue around Freddie Gray. He had high levels of lead. When they did lab tests as part of his autopsy, he had high levels of lead. In fact, it was known that from his childhood he tested positive for high levels of lead. And so, like where I'm at, when he grew up in housing projects, and the reason I bring it up is because they may paint over it, but kids will still peel at those walls. They'll play with the walls. They'll
put it in their mouth.
And lead-based paints taste sweet and to children, and so they will eat it. So that's the principal reason how they end up, getting the high levels of lead poison. Not to mention that it is in the water sources, and unfortunately, it does get into the bone. And there's a specific, and probably maybe Johnny Blaze may be specific, may be familiar with this, but there is you do something called chelating.
No, I'm not familiar with that one.
Yeah, and so what chelating does is that you take a specific compound, they ingest it, usually something maybe like they'll use like potassium, for example. If you don't, because the thyroid is very keen to absorbing radiation, they or radioactive iodine.
Okay, so now, so we use what is it in nukes? It's
potassium iodide.
Yeah, or 131.
Yep.
Mm-hmm. Yes.
And so there, that's one way you can do. That's one chelating agent to keep the thyroid, for example, absorbed. But there's other things. There are other agents that are used as chelating agents, and what they do, they bind to those heavy metals, and so it doesn't allow your body to doesn't allow it to get digested, so it just becomes part of your stool. And so whenever you have a bowel movement, it just comes out that way, or you urinate it out. So those are typically ways you can get rid of, you can chelate it. But again, the problem is that once lead is in your bones, yeah, that's pretty hard.
Yeah.
So that's what they mean when you're like, oh, I feel it in my bones.
But given that we started this off talking about healthcare, but specifically prostate cancer in Black men, I do want to reiterate something, because I think part of what has to happen for Black men, there has to be a commitment, especially for older Black men, and you have sons. You really need to be telling your sons about history of prostate cancer in your family. There's a high likelihood that most Black men want to sit in the chat. Obviously, I use myself as an example. My grandfather had it. Now he's the only male that I know of in my family that had it. And so, again, I'm always hyper aware of it because it was in my family. And so, it is older Black men's due diligence to tell their sons and their nephews about who has had prostate cancer. Because again, it just may save their life. Because even though the CDC guidelines recommend 45 for PSA testing, I am specific. If you want a recommendation, here's a recommendation right here. I am specifically telling Black men, get it at 40.
Yep.
I don't give a damn what the damn CDC guideline is. Get it at 40. Because I can't tell how many men I've met, 41, 42. I'm going through therapy for prostate cancer. I can't tell you the number of men I've met. I met men that are 20-year survivors say, yeah, I got it at 40.
I just had mine checked this year. For 2019, my PSA.
Yeah.
Yeah, I was discussing this earlier with Dr. Phoenix, and I said, for my 40th, I'm only 30, not only, but I'm 36. So I'll be 37 this year. But at 40, I'm going to get my colonoscopy. But at the same time, because they're already going to be in there, I'm requesting that they do a biopsy on my prostate.
Mm-hmm.
And mainly because, I knew my grandfather had it. He officially didn't die from prostate cancer, but he had it. But he did die in 2013. I didn't find out that my father's brother had it. He's alive. He's healthy. That he had it. I didn't find that out until last year. And my dad has prostate cancer, and and he's going to die. And as of right now, he's in the hospital, all this stuff, and it's like, this shit's not a joke. But I wasn't paying attention until I first learned my grandfather had it back in 2010, 2011. And I'm a very healthy person. I'm always up to date on my health, all that other stuff. But I wasn't really thinking about prostate cancer until then. And it's just 2020.
Interesting.
Yeah. And again, this is why the key to prostate cancer is certainly going to be in early detection and prevention from the outset. This is the key, is really early detection. Again, prostate cancers are very treatable if you catch them early.
Stage 1, it's easy to cure. But as Dr. Phoenix stated, amongst Black men, West African, guess where my family's from? Liberia, West Africa. There you go.
Yeah. And so, the problem is that Black men in general, and this has a lot to do with that John Henryism that I talked about earlier, which is that Black men will refuse to go because you think you can work through it, you can power through it, or whatever the case may be. And so you finally this, the symptoms get unbearable. You have to finally go see somebody. Now you got told you stage 3. And there's not, we can try this, but we give you maybe about a 5% chance it may be effective.
Mm-hmm.
And so this is something where Black men, and Reigning Woman is exactly correct. Black men should go, should encourage each other. And I'll give you a personal story, something that I did just about a month or two ago. There was a older gentleman, he's from Ghana, used to be a chemistry professor, but he had an enlarged prostate. And so he had surgery done. There's like outpatient laser surgery that they can do to deal with enlarged prostates. And so, I went with him, because, he didn't really have anyone. And so, he's a 70-year-old gentleman, and I just went with him because him and I know each other from some events that I attended. We met there and just kind of been talking since then. And so anyhow, I said it to say that, he was telling me about what's going on, because I always made myself available and say, like, yeah, if you have questions, feel free to, ask me. And so he was saying he had asked me if I can go with him to this event because, he didn't feel real comfortable just kind of being around, ironically, all these white folks. And so I said, yeah, no problem. And so I went with him to a couple of his points. I went with him to the initial and then went with him to his follow-up. And so, that's just something I did, just as a set aside, and how Black men, we can be our best advocates for each other. And just helping each other understand, or well, not even understand, but encouraging each other to, get those wellness appointments when you go see your primary care provider. As for the PSA exam, yes, even as for that digital rectal exam, I know Black men think it's a joke and they run from it, but yes, you need to have it done at some point.
Yep.
Because I'd much rather you face a few minutes of, if you want to call it humiliation, then you have your life cut short because you just refused to do what was needed to protect yourself. And so, I'd much rather that be the case than the latter. But also,
yeah, Black men, don't be an asshole either way.
It's a painful way to go.
Yeah,
and it could be fast. I mean, like I said, I didn't really know too much about it until about 10 years ago, and even then, I didn't. I mean, not that I didn't take it serious, but I didn't really start really reading hardcore literature until like a few months ago. And that's when I contacted Dr. Phoenix. I'm like, hey man, just because I read it, I'm not in the medical field. I need to talk to someone who knows something and who's been there and seen stuff. And everything he said, I mean, it was like he was in our walls. Literally. It's not a game.
Yeah, I think, if anyone that's ever had a loved one that's ever had the cancer, died from it, it really is a horrible way to go. If there's anything that's truly heartbreaking, is kind of watch someone die from cancer. That it truly is a heartbreaking thing. Because I mean, one of the articles that Mike read off earlier, they were talking about fentanyl. I think it was the one with the opioid crisis. Fentanyl is often used as an analgesic to deal with pain for end-stage cancer, because that's one of the few medications out there on the market that's powerful enough to actually control the pain associated with cancer. Because for folks, especially for folks in end-stage cancer, they're always in pain.
Yep.
And so that's if you just kind of watch them waste away, literally, because that's ultimately what kills them. They waste away for the most part.
Yeah. Yeah, it starts attacking other vital organs, and I mean, it's a freaking wrap. I mean, I was telling Dr. Phoenix, my dad we are not fat people at all. Actually, we're very muscular people. And I moved out of Rhode Island almost 4 years ago now. So as far as I was concerned, he was cool. He was good. And all of a sudden, he started having seizures out of nowhere. I'm assuming maybe the end of 2017, and I wasn't told anything until like January, February. So I went to go see him in March of last year. I just popped in where he worked, and as soon as I saw him, I'm like, yo, this dude has lost a lot of muscle mass. First thing that came to mind, there's no way in hell that it's seizures. First thing that came to mind, I think it's cancer. I didn't say anything to him, but I knew something wasn't right. I just knew. The shit is serious.
Yeah, most black people, well, I shouldn't say most black people, most black men don't take this stuff seriously until it's too late. They wait until the last minute, which is what drives up the cost in healthcare, because now you're tackling a million issues rather than just that one minor issue you might have gotten to had they been more frequent visits.
Yeah. Yep.
No, and that's exactly, and you're 100% correct, Mike. I mean, you know, these are issues that really you need to address them before they become major issues.
Mm-hmm.
You know, you know, some inconvenience will probably save your life, especially for
Yeah.
brothers that know that they have a family history of cancer. Again, I can't stress enough why it's so important for brothers to share their family's medical history with their sons,
Mm-hmm.
especially when you have a history of prostate cancer, colorectal cancer, because those are the two major cancers that kill black men.
Yeah.
And so again, for black men, understanding that this should just be part and parcel of just information and knowledge that's passed down in exchange from father to son. And again, as Sauchi and I were talking, you know he's finding out a little later in the process, but again, is you, you you see a family member, you think something is wrong, and again, this comes back to families just turning every damn thing into some damn urban legend.
Yep.
And you know what you're seeing, but it's just like, yeah, he just a little sick here, he got pneumonia, he'll be okay. And then you know yeah, grandfather XYZ turns up dead. Oh well, yeah, he had that mysterious disease nobody knows about. Yeah, they killed him. And this is what typically happens in black families, is that everything just has to become this mystery. You have to go digging, and I think we just do subsequent generations. Um, we do them a hell of a disservice by just not sharing basic health information, family health information, because a lot of what kind of guides the treatment that you get, especially with as it relates to cancer, is also understanding your family history. Why it's so important to do whole genome sequences, because
Yeah.
if you have such a high prevalence of cancer within a family, it may suggest that you may have some genes that may be in particular that may make you more or less sensitive to the development of prostate cancer. And so that
Mhm.
needs to be, obviously that needs to be investigated. And so understanding that has to be part of your entire treatment, is understanding whether or not you have genes that make you more susceptible to development of prostate cancer, but also understanding that also may very well affect how the treatments may work for you. Every treatment does not work the same on every single patient.
Yep.
That's why you have to do whole genome sequences. You have to do, that's why you have this whole new field of pharmacogenomics popping up,
Yep.
because you having to understand that people respond differently based on their genetics. So,
Mm-hmm.
so yeah, I'll leave it at that.
Yeah, thank you all for joining us, man. Please hit the like button if you're not already done so. Share the video if possible. Also hit that notification bell so you get all the updates from the Black Brain Trust, including those posted on the community tab. Doc in the description beneath the video for you to reference. Thank you to Dr. Phoenix for coming out and actually sharing all his knowledge with us on the panel and in the chat. Sauchi, thank you for coming up as well and helping me hold it down. And shalom, everyone, as well as Johnny Blaze. Thank you.